The Select Board meeting for June 16th, 2020 to order. Thank you for joining us this evening. For tonight, we'll be broadcast on RCTV, Verizon Channel 33, Xfinity Channel 22, as well as on Facebook Live, the link from RCTV and YouTube. For public comment, we're using the same format that we have the last several weeks. Allocating time at the beginning of the meeting for general public comment, and then some time in front of public hearings for folks who would like to speak to those. Public comment must include your full name and address, not include disparaging comments, and have content of not more than 2 minutes, please. The way to do this is to indicate your desire to speak before the meeting, and this is published in our in our agenda in advance of the meeting. We ask that you let us know that you'd like to speak, and we will set up appropriate time for you to do that. Just to reiterate for everyone again, the resources available for the town in general and specific to COVID-19. You can always go to the town website, readingma.gov, and then at the top, you'll see a red band that indicates all the information related to COVID-19 and emergency services. If you need to reach out to people, you can do it by email or by telephone. For email, Human and Elder Services, Kevin and Carrie are doing a magnificent job. Please reach out to covid-19help@ci.reading.ma.us. If you'd like to volunteer, and many people have, it's been great, you can reach out to Matt and Jane, COVID-19 volunteer at ci.reading.ma.us. And general questions, Matt and Bob will be fielding those, COVID-19 at ci.reading.ma.us. If you would like to reach out by telephone, we have a system whereby there are a menu of options. You can leave your name and number, and someone will get back in touch with you. If at any time you need urgent help, you should always be calling 911 in case of an emergency. If it's non-urgent help, you can call 942-6680, and you can see the options here that range from non-urgent help to volunteering to general questions to sign up for Code Red. And finally, if there are issues about businesses not following the state or Board of Health guidelines, you can press number 5. Tonight's agenda, we will stick with our format that we've been using during the COVID-19 crisis. We'll start it with the response. The Board of Health, Eleanor Shonkoff is here, who's the chair of the Board of Health. She'll provide some updates. Bob will provide from the town side. We'll then go on to liaison reports, and if there are any town manager activities, we'll do them there. At about 7:35, we'll move to public comment. Caitlin, I think we have 2 comments. Is that right? 2 folks?
I only know of one.
Okay, so just one. Okay, just one, actually, correct. I have another person who sent a note to the board saying they couldn't join, but asked if we would read it.
Oh, yes. Yeah. One joining, sorry.
One joining. Yep, you're correct. Thank you. After public comment, we will, I'm not sure where we are on the liquor licenses. Do we have an opinion that allows us to move ahead, Bob? Oh, you're muted.
Move ahead, yes, but subject to conditions.
Okay, so in fact, we will do this. We'll have a discussion about approval of some liquor licenses. We have a contract, a municipal agreement, the Metro North Regional Housing Services that was in our packet. About 8 o'clock, we'll move on to a discussion about the water tank and cell tower project and reconsidering how we're going to approach that project based on some bids that have not been in compliance with what we were looking for. At 8:20, we'll move to the VASC and do appointment of a series of volunteers. 9 o'clock, we'll shift over and do a discussion of the town manager goals for fiscal 21, as well as the review process for fiscal 20. We'll get that process started tonight, and I think it'll take us a few weeks to kind of have that discussion and get to where we want to be. About 9:20, we'll talk about the select board retreat. Discussing kind of what we want to have happen and the design that we're looking for, what we'd like to have happen from that, and the timing, which hopefully we can do in July. About 9:40, we will shift to future meeting agenda topics, and then we're going to move to an executive session at 9:50 to discuss some real estate issues. So with that, let me turn it over to Eleanor Shonkoff from the Board of Health to talk about updates, and I'll run slides for you if you'd like, Eleanor.
Sure, great, thank you. Thanks so much. So we have met 4 times since the last time that we gave a select board update. So I'll just talk kind of big picture about some of the work that we've been doing. We have passed a motion to suspend enforcement of parking under zoning for food establishments in order to help some restaurants open up outdoor dining, which has been done in collaboration with the select board to open up different types of restaurants to allow them to have outdoor dining. And that's contingent on review of their opening plans. But that lasts through November 30th. We've changed slightly the civic function permits. The health agent used to only review those when there was food involved, but for the purposes of COVID and while that we are in a pandemic, we're going to send all civic function permits will be reviewed by the health agent, sort of pending changes in the public health metrics that we're using to review that. Another thing that we've done in collaboration with the select board has been nurse staffing, and we have been able to get the MOA with to allow the school nurses to be able to continue to serve throughout the summer if they volunteer to do so. And what we're looking on now is fall to be able to have adequate staffing to do contact tracing there. And I have a few more updates about that. I have a slide about that subsequently. In terms of opening outdoor spaces like parks and recreational areas, the work that we've been doing there has really been to coordinate with the school and with the recreation department of the town to figure out how to implement the Massachusetts guidelines, which have included things like routine cleaning. So there are some questions around what the cleaning practices were before and what they're going to continue to be moving forward. So right now we are awaiting review of a sign that will basically let people know which areas have do not routinely get cleaned, so that people be aware of that risk when those places are open. So I had mentioned the reviewing the protocols for spaces reopening and recreation. We have ongoing review for youth recreation activities and different buildings that we're looking at reopening. And I have some guidance in a subsequent slide to let people know who are considering submitting any protocols, what we're using to evaluate those. And then just wanted to just to keep on our radar, the September 1st election safety, that we are in the process of planning a communication outreach in order to best make sure that we get the highest number of people who are able to contribute by voting in rather than in person. So if you want to move to the next slide, that would be great. Thanks. So Mark, you had already shared the contact information. I just wanted to remind people that we have the email address. If you want to volunteer, you can also send an email to the COVID-19 volunteer email address that you mentioned. You can call the town. If you just go to the town website and click down there at the bottom with the telephone number, you can call there and also ask, press 7 for the health department. So the reason that I'm emphasizing this is that Massachusetts has set up COVID enforcement to be largely complaint-based. So we are asking if people see something to let us know. The town is doing its best to start to manage and drive around and monitor who is where, but we are also relying on town members to let us know what they see. And you can go ahead and go to the next slide. So I mentioned that we have the school nurses through the summer on a volunteer basis, but we are, if they volunteer to do so, they will be paid for that work. But for the fall, we want to take the first approach of asking for volunteers from the community. So if there are people living in Reading who do have medical experience and who are looking for a volunteer opportunity to do contact tracing, if they're willing to undergo the training, this might be some place where they would be able to contribute. So I wanted to reach out and let people in the town know that, because right now for fall, and this would be in anticipation of fall, so there might be training that they could undergo during the summer in order to be up and running in the fall, because in the fall when school opens, and when things like the senior center open, where a nurse advocate, her primary appointment is, they're going to, by nature of that, have less time available to do the contact tracing. So we do have two options there. There is a contact tracing collaborative through the state of Massachusetts, where if you haven't claimed a case by a certain amount of, by the end of the day, they sort of take that case away and they do the contact tracing. So the benefit there is that we wouldn't have to provide the staff to do the contact tracing. The con is that we sort of lose ownership of that case. And so the metrics that we're using and tracking will not continue to be the same over time as what we've done. And there may be a delay where first responders would wait until the information came across through Maven. So there may or may not be a delay. It's just that we lose some control when we do the contact tracing collaborative. But that's not to say that it won't be the right option. We just want to also make it known that if there are people who are willing to volunteer for the fall, that's something that we like to start with. Could you go to the next slide? Thank you. So previously I had mentioned that we've done a lot of reviewing protocols. Once we have a system in place for that, I think these protocols will be reviewed by the health department, but right now the whole board is taking a look at all of them. So I wanted to go ahead and let people know how we're evaluating them. If you go to mass.gov, you'll find there at this link the reopening sector-specific protocols and best practices. So they have them for many different, libraries, golf courses. The one that I've given the example of here is office spaces. So if you scroll to that side at the bottom, you'll find all the different sectors. There's also any sector not covered above list. And once you click on those, you can go to the bottom and find a pretty PDF version of the checklist. There's also a lot of additional information about protocols there. So anyone who's considering submitting a protocol can actually go ahead, go look at the checklist, review it themselves before they send it to us, because that's what we're going to use to guide our evaluation of these going forward. And that's been consistent with what we've done throughout, is to use that Mass Department of Public Health guidance. Although we're also consulting CDC website for best practices, this is what we're using for review. Great. And then I just had the two last slides. I thought I'd give an update of the slides that I presented previously. This one is the 7-day moving average of new cases. So one change since the last select board update is now that we're only reporting the COVID numbers weekly. So it gets updated weekly on the website instead of by day. And this is consistent with what the state and other towns are doing for some numbers, but the state is reporting some numbers daily, but for the towns, they report that weekly. And I think other towns are updating their websites weekly. So as of June 9th, we had a confirmed positive of 313. Of those at that date, 162 were active, 118 have recovered, and 33 have passed. Again, you see that we're continuing on that downward slope toward the end. I anticipate that as things open up, we will start to see an uptick again, but suspect that it will be a lower point than this one. So this is just something that we'll continue to watch and monitor, and I can continue to share with you. And then the last slide, thanks. So this is one of the public health metrics that the state is using to consider reopening. On the bottom, you see the state's 3-day moving average of deaths, which has declined over time. It's pretty consistently declining in that downward slope. And then again, the caveat I mentioned before with looking at this in a town of Reading, which is small, for a significant amount of time, we have 0 deaths, which is great. It's just that given a smaller population, you are not going to see the sort of smooth downward slope that you would with the state level data and a higher sample size. But this is also something that we'll obviously continue to monitor and watch as well. So those are my updates. Yeah, questions, thoughts?
Board members, questions?
Oh, I did forget to mention something.
Please.
Along with outdoor dining, we were going to give the update that we do have 8 restaurants that have now opened. I can read the list if you're interested, but
yeah, absolutely.
Sure. So Green Tomatoes, Christopher's, Professor's Market, Caffe Nero, Bunratty, Venetian Moon, Last Corner, and Fusion Cafe. have all opened now, been inspected.
Excellent. Excellent. Eleanor, when do you think the signs are going to be going up so that people can know what the right things to do are at the fields and things like that? What's the timing?
That's a good question. I don't know the answer to it.
Can help
As
with
soon as
that.
possible. Oh, great.
Yeah, we just heard back from town council and he said everything looks good. So I'll get with facilities tomorrow and we'll move forward on that.
Awesome.
Great. So probably later this week, if things are great, or do you think it's more like next week, Jean?
I think facilities can work pretty quickly. They'll get them up there as soon as they can. I don't know what that means, but I've always had that experience with facilities.
Great. Great. And that'll give some guidance about assembly and number of people, things like that. The issues about cleaning. I think the biggest issue discussed at command was that there typically are not cleaning protocols and should stay clear of contact surfaces.
Right. So the sign says, I think it has 5 things on it, basically icons at the bottom to let people know it's not clean, to let people know they have to wear masks, and to stay 6 feet away from one another. I'm not sure whether the limitation on gathering is on that sign. I can double check and forward it to the select board.
Great. Thank you. Any other questions, folks?
Mark, I have a question.
Please, Vanessa.
Thanks. Eleanor, thanks for your update. That's great. Especially great news about the restaurants. I did have a question about the website. This actually might be a better question for Bob, but last I had checked, it was updated June 3rd. So do we have, which is now almost 2 weeks ago, do we have more recent data that can be put on there?
Yep, we do. So actually the data that's up is from June 9th. I emailed with Jane this morning. It would just, the text at the top didn't get updated when the actual numbers got updated.
Good.
So it
Thank you
should
very
be,
much.
yep, good catch. It should be updated every Wednesday at 4 p.m.
Wonderful. Thanks very much.
Any other questions?
I have the sign here. If you want to let me share, I can just pop it up if that'd be helpful.
Absolutely. Please.
I did have a question about the contact tracing for the fall.
Mm-hmm.
So to rely on volunteers, we certainly are a community that relies on volunteers. Like, I think this meeting is a case in point for that. You know, does contact tracing make sense to rely on volunteers for, or do we want to make sure that we have, and I know that there's an additional $30,000 for next year's budget for health purposes, which could be towards contact tracing services. But do we want to rely on, does it make sense to rely on volunteers for contact tracing, where that's a very much, you know, it's a real job. So curious the thinking that went into potentially relying on volunteers for that.
Great. Good question. So you bring up the budget that we have for that, and that's something that we're absolutely considering too, is having that money set aside to be for contact tracing, or having it be set aside for inspectors if we need that as more things reopen. It's basically set aside for, we're considering right now just having it be devoted to staffing, because that's where we think the need is going to be in the fall. We thought that we would start by reaching out and looking at what the volunteer pool would look like. It does seem like, because we have a lot of medical personnel who live in Reading, we thought that we would start there, because it really does, you need to be able to answer questions about COVID. You need to be able to ask good follow-up questions and understand the answers. So we would be looking for people who have that medical experience and who would be able to undergo the significant training. So the reason that we thought we would start with the volunteers is because we want to see who sort of what types of experience do the people who come forward have, and would that make sense if they understood the time commitment and had that professional experience and wanted to be able to contribute given the requirements that would be put on them. But if that doesn't work, then the budget we have is there for hiring some.
Okay. Great, thank you. That helps to answer my question.
Gee, I said this is the sign, except we're a place to keep Belmont healthy on the bottom.
Exactly.
Awesome. That looked great. Any other questions from board members?
Mark?
Yes, please, Carl.
Hey, could be a question for Eleanor or Jean. How many restaurants with alcohol have requested outdoor seating?
If we could just delay on that, we have a few more things to say.
Okay.
Any other questions? Great. Thanks, Eleanor. Much appreciated.
Great.
Bob, do you want to take town side, please?
Yeah.
Mark,
Thanks,
quick
Eleanor.
question.
Oh, sorry, Karen, go ahead.
Sorry, fumbling with my unmute button. Eleanor, thank you for a wonderful update as usual, and thank you for all your hard work. I was just wondering if there's been any indication that there might be additional grant money coming out to towns to help with some of the things that you're tackling.
That's a great question. I don't know the answer to that. Let me check with our health agent and I can get back to you.
Okay, super.
I mean, we have been regularly getting them, so I don't know how long that continues from the Office of Emergency Preparedness.
Thanks. All right, Bob.
Thank you. I want to follow up on one of the items that Eleanor discussed and just thank the teachers union and the school administration for agreeing to another MOA to allow the school nurses to work through whenever school starts, whenever that may be. At some point on your draft agenda, you saw perhaps declaring the school nurses special employees, which would allow them to be paid by the town and the schools. But all of them worked more than, I think it was 840 hours, which disqualifies them from that. So the schools and the town have just agreed we'll figure out the money later. It's just not an urgent issue. So I really appreciate the schools pitching in like this. In terms of September school opening, there's probably more questions than answers. I was on a call with the Lieutenant Governor today, and it was really, September's a long way off. Catherine Hornby, the Undersecretary of Administration and Finance, suggested today for the first time that the state would very likely in July and probably August have a 1/12 budget for itself and not have a balanced budget for FY21. And the reason for that, in round numbers, the state has qualified for, I guess I'll say, $2.5 billion of federal funding so far. There's potentially another $21 billion on the horizon. With 14 of that to go directly to the states and 7 to go to cities and towns. So that's the reason the state, in real short summary, that's the reason the state does not have a budget, because they don't know with such a huge number. They're certain that that huge number will not come through, but even a good percent of a huge number is interesting. So the state budget is really going to take a while to sort out. They're not quite sure what they're going to do with state aid. It's possible they'll just do a 1/12 budget of state aid as well. So we'll see. And on that, I'd really like to thank everyone who participated in town meeting last night. We're really glad that we have a budget for next year. It's just so much easier in so many other ways, and we'll adapt as we need to. Thanks to the Board of Health and everyone else who also made the Performing Arts Center safe. I understand 6 town meeting members used it last night, including Steve Crook, the assistant moderator. So that was a really nice resource. It allowed people, for whatever reason, to not need to remote in. So that was very helpful. The last legislative update I have is no update from the Senate on the elections bill. There hasn't been any action, and it is, I believe, going to be something that's taken up in the next week or so, is what I heard today. Lastly, I'd like to turn it over to Jean for an update on the outdoor dining that Carlo and others were interested in.
G&T, all to you.
Okay.
I think I believe the Senate passed vote by mail legislation today.
Okay, great.
Just today, quite recently. Breaking news.
Okay, bear with me, guys.
I can share your presentation if that's helpful.
I get it. It's just fighting me a little. Here it comes. Okay. So this is, I think, the third time I'm before you to talk about outdoor dining. and what's going on. So just to recap, the expanded streamlined existing outdoor dining license was acted upon back on June 3rd. And we now have a two-tiered system for doing licenses, and that's by the town manager. Eleanor mentioned the Board of Health order to suspend enforcement of parking regulations under zoning. And these are for restaurants that have parking requirements that can convert those parking spaces into outdoor dining areas. Most of the downtown, if not all, restaurants do not have requirements for off-street parking under zoning because there's a provision that if you're within 300 feet of a public parking lot, you're not required to provide off-street parking. It's the downtown. The other item that I've talked about at least once is the bistro tables that we are working together with the business community and the chamber to roll out a pilot program to support downtown businesses with bistro tables and chairs. And I just got the word that they're in, so that's very exciting. We've been, the hardest part on that one has been the ordering and getting the outdoor furniture. It's very difficult given the COVID situation. And then the COVID-19 review and approval of existing patios. That's just a cursory review for some of the private patios. And the acronym EAT is the Expedited Approval Team. So we've been hard at work with that group. So here's an example of a success story of outdoor dining. This photo was taken yesterday by yours truly. Erin and I got the chance to walk around and talk to people. And we did it social distancing with masks on. But we often find that sometimes it's just good to get out and pound the pavement. And so we do that a fair amount of the time. And I always enjoy it, and I always learn a few things when I do it and meet a few more people. And that is why we do this work, so that we can serve the public. And as you can see, we have two happy people here enjoying breakfast at Christopher's on their patio. So that's going very nicely. And that they were the first one. We approved them, and they were the first one to start as soon as outdoor dining was available. So that was last Wednesday when they opened this. The second success story is, again, a private patio. But this is Bunratty Tavern, and they're doing great and have a lot of success. We talk to them all the time, and they have some ideas, so they may be coming back to you with some thoughts and different ways that they can expand on this. But this program is working very nicely for them. And then we have this High Street area, Green Tomato in particular. We know we have a little bit of sprucing up to do, and I'm very thankful that our DPW is going to help us with what's not the most beautiful trash barrel here and some other items that we talked to the owners of Green Tomato, and they're thrilled that we can give them a hand with this. And that'll be a really nice, we've reached out to the Garden Club to help spruce up. And so we're looking forward to that as well. But Green Tomato is doing great. Obviously, their business is mostly takeout, but we're working with them on some ways to activate this patio area. I won't bore you with all the details, but we love that kind of stuff. So we're having fun with that. This is the side of the last corner. So these tables are tucked in. We have some suggestions for them, particularly with the wheel stops being so close to the table. So we're going to have some more discussion about this, and hopefully with the new rollout of the bistro tables, they'll just focus on High Street. But I think for now, people are doing the best they can to survive. So kudos to them. So this is more or less what we're talking about for the bistro table program. The tables that we're getting are square, which will work out very nicely once you see how we're going to shoehorn them in. So here's location number 1. This is the last corner on High Street, and we've taped out where the bistro tables and chairs will go. So they'll get 2 tables, 4 chairs, and they'll be on underneath these windows, and it'll fit very nicely. All of these locations have been reviewed and approved by our expedited approval team. And so with everything hopefully going to go well tomorrow, picking them up and setting them up in the next few days, you should see them out there. Number 2 is Green Tomato. As I say, they're mostly a takeout operation. They don't always have these tables out. And so in the meantime, we're going to help them out with some tables here under this window, 1 in particular, maybe 2 on the other side. And number 3 is Professor's Market. This is a business that also does a lot of carryout, and when the new residents move in at Rise 467, the old Sunoco station, they're already queued up with a grab and go system, which is fabulous. They're really fully stocked. I was really, really impressed at how well they were preparing for when that happens. So in the meantime, when we talked about the bistro tables, they were very excited. Again, those would go under the window here, 2 tables, 4 chairs. And there's sufficient clearance for code and such. And number 4 is Fusion Caffe. I'm not sure, they're probably going to at least get 1. We're going to see how it looks, either 1 set or 2, if they can make use of that. And again, the beauty of this program is the town just basically gives them the furniture, and they can put it out in the morning, take it in at night. We're not involved in that. They can, have the benefit of it without much bother of dragging their own tables out and wear and tear on their own tables and chairs. So when I talked to the business, I said, if you wanted to put your own out, you could. And they said, no, because we really don't want to ruin our own stuff and the bother of dragging them in and out. And we're so short-staffed. So this really does fill a need that hopefully will be a real winner. And then Cafe Nero, they opted to put their own furniture out here. We measured everything. Everything's laid out beautifully. We made some suggestions about their sign here, but it is what it is, and they're surviving. And you see, there's a wingback chair here, which is kind of interesting. So everybody's trying to just come up with creative ways, and there's been a lot of people using these tables at Cafe Nero. I've been by several times and amazed at how active it is. So the one that is probably the one you're all most interested in is the outdoor dining license for Venetian Moon. And Venetian Moon is a tier 2. So all of the basic sidewalk tables really is a tier 1 and fairly simple. But tier 2 gets more involved. We have things like building codes. When you put a tent up, it's considered a structure. So you must file for a building permit and you must meet building code, have things like exit signs and the like. Likewise with fire codes. This you can see a lot of notations here about fire extinguishers and access points and that kind of thing. But we did review this today with the expedited approval team, and we had a very good meeting, and we had, I think, almost everyone sign off. There's a couple of minor things that we're waiting on. We're waiting for a couple of small permitting things that are not major. The staff, fire, building, and police staff were out there this afternoon, and we think that this is probably going to be set up in the coming few days.
Fabulous.
So this gives you a clearer picture of exactly what I'm talking about. So the liquor license, obviously that's on your agenda tonight, and then as well on June 30th. And that's if needed, the public hearing for June 30th. And we are waiting for some pending legislative fixes so that an earlier date would be a time when we could issue this liquor license, pending approval tonight by the select board. The block plan review, and that's the aspect of the selectmen's policy that requires a butter notification by the applicant. And so this is where we, this particular application requires closing off the cobblestone parking lot. So we want to make sure that the abutter is speaking with their neighbors and that it's generally something that people are in favor of. So we got letters of support or emails from their landlord, Caffe Nero. They're actually interested in creating a cafe area, outside dining area next to the tent. Nella's Pizza, also interested in taking advantage of this area. Sims Jewelers, Anya's, and then a handful of other related businesses in the downtown. I think there might have been some late emails that came in after the presentation was prepared, so there's a few more. The summary on the permits is the fire has approved, health has approved, building is pretty much approved. They just need the applicant to file for an electrical permit. And I spoke with our electrical inspector, who has been speaking with their electrician. So they're working together, and they believe that they will get that squared away by tomorrow. A street occupancy permit is required. Engineering has approved that. And we're going to be installing Jersey barriers that DPW would be providing on both entrances. So the Woburn Street entrance and the Main Street exit will have Jersey barriers secured with reflective tape to make sure that it's safe. So that is basically my summary of where we're at with outdoor dining. We do have, as Eleanor mentioned, a number of restaurants, and we're very happy that this is a bright light for the restaurant community. As you know, the sales have been anywhere from 25, 30, 35%, and that's just not sustainable. And so we're very concerned about the possibility of businesses not surviving this time. And that's why things like the Bistro table program, we just said, let's do something. And thanks to the board for supporting efforts like the one you passed a few weeks ago, so that we can offer the creative opportunity for businesses to do some things that they'd like to do, like Venetian Moon.
Fabulous. Questions from board members?
I have a question.
Please, Vanessa.
Jean, thank you very much for the update. This is great news for all the restaurants that are already open. Is Venetian Moon the only one who is outstanding?
They're the only application, yes.
Okay. So is this number of permits and requirements standard? Because it sounds, at a time when we want to be friendly to businesses, it sounds like an awful lot of hoops that they have to jump through in order to get across the finish line, especially if they're in any kind of unorthodox situation like Venetian Moon is. So I just want to make sure that if there's anything we can do to streamline this effort, and I know that the idea of the EAT initiative has helped that, but I know that some of these have taken several weeks to sort of get to where we are now, and that's a lot of time for them. So anything that we can do to help make this faster for them, I think would be appreciated for any future ones that may come.
Definitely. So just so the board's aware, we received the application from Venetian Moon on June 8th. And there were the items, the summary items that I am showing you. These are all health, fire, and safety code requirements. A tent is a structure. And so under the International Building Code, we are required to make sure that we're following all of the code requirements. God forbid there were a fire. God forbid someone couldn't get out of the tent. These are the things that we worry about and we're responsible for when we permit a structure like a tent. So it probably seems like it's a lot of hoops to jump through, but safety and, that's number one. So when we received the application materials on June 8th, and mostly the work is done by the tent company, they often have a few things that are missing. And so we almost daily had email exchanges back and forth with the tent company. And then as recent as yesterday, the tent company we were waiting for them for more information to clarify a question by public safety and building. So, so basically it took a week. Given the fact that this is probably the most complex and involved application, it's our first one, and it had to be, of course, it's complex. I wish it was a day, but I don't think a week is that bad, considering they had to really make sure that they talked to their neighbors and get responses from them and go make sure all the health and safety items were straightened out and properly vetted. We're doing the work of the Jersey barrier. I think it went okay. I'm hoping next time it'll go even faster, but I think a week is not bad.
Thank you for your due diligence.
Gene, are there other liquor license holders that are we've contacted or have contacted us that might have some interest?
So we have just posted the application materials on the website, and we have about a half a dozen businesses that have approached us, some with liquor, some not. So I think that that's something to think about, because going forward, June 30th is 2 weeks from today, and then there's a 3-week gap in case anything needs to come back to the select board. That's maybe something to give some thought to.
Yeah, I won't speak for the entire board, but I would imagine if there were an opportunity to come back to approve a license, we would all give that pretty serious consideration about coming in much sooner. So I wouldn't, if that helps move things along, that's great. But I think if coming in sooner can make a difference for somebody to get going, we'll see if we can get a quorum.
Okay, that's great.
When the applicant from Venetian Moon's here, I'm going to give you more of an update on the liquor license. But just understand, as the legislation is currently, it is a requirement that we have a 2-week public notification period, and that's a significant delay when someone wants to get going. I am hopeful, I believe, and Ann may know, the House may have passed 4767 this morning. I'm not sure. They were close. And among other things, it would remove the 2-week public notice. So if and when that becomes legislation, this problem becomes much easier to manage. Then, for instance, we just need the 48-hour period to call a select board meeting, have an applicant in, and off you go.
Yep. Is part of what you're putting up, Gene and Aaron, is information that would help folks if they decide they do want to apply, to give them kind of a checklist of things, including talking to their neighbors?
Yes.
Awesome. And select board members, Aaron is going to come in at our next meeting, and I think what we probably should do is just make this a general part of our ongoing meetings, to provide an update. What's happening, contacts that have been made, where the businesses are, things that they need, what we can do to help.
I don't know off the tip of my tongue where each 4767 is, but I can look it up if folks are interested.
Okay, thanks, Ann.
Any other questions from board members? Karen?
Thank you, Mr. Chair. This is great. I'm glad we're moving forward on this. I look forward to dining outside in Reading. And on the topic of what else can we do for our businesses, putting up the slide of Caffe Nero reminded me that one of the managers had asked earlier this year what it would take to get the trees pruned in front of his store so that people could see Caffe Nero. And being new to the board and having the right people here, can I ask what should a business person do to get the trees trimmed? How do they reach out?
I'd say the best thing to do, and he mentioned it to me as well.
Okay, good.
Is either work through Aaron, or they can go right online to See Click Fix.
Awesome. Okay, great. That's easy.
I recommend See Click Fix.
Okay.
I think the beauty of See Click Fix is it immediately gets deployed electronically to the right place.
Okay, let's use it. All right, thank you.
Can we just share the, so it's seeclickfix.com is the website for those not familiar with it. I'm going to see, let's see, it's a race to see who can get the site up first and put it up. Oops, except I'm not logged in.
Mark, while you do that, I have a question or more comment.
Please.
So this actually, the tree trimming has come up every year, especially along that particular stretch of Main Street. For Jean or Aaron, is it possible to, as part of our tree maintenance schedule, that perhaps in the spring or summer, I don't know how often you have to trim these trees, but that be part of the standard maintenance for this area? So that way it's not on the business owners, it's something that the town, we know it's an issue, so can we just take care of it for them?
Yeah, I'm not sure if we have a standard program, but I can certainly follow up with Jane Kinsella from DPW.
We do have a standard program that they review every year, all of the trees. They do a drive-through, walk through various areas. I think the one problem with the downtown trees is that you can't over prune those, because then they get these shoots and you have a mess of a tree. The height is granted, it's blocking signage, but if you trim it too much, you're going to have another problem with the trees. So that's why he's very hesitant. It really doesn't need as much trimming as they would like, because the problem is the viewing of their sign. And until that tree grows, you're going to have that problem.
I did suggest to the manager about other alternatives. We do have the A-frame sign program, and we do have temporary banners. So I made those two suggestions that we could easily permit something like that. So Erin, I know, is following up with them to see if there are some other ways that we can help them. If they do pull tables out into this cobblestone area, that's going to attract more foot traffic. And enlivening this area and generating more foot traffic for the downtown generally is going to really benefit everybody. This is the goal that we've been striving for the 10 years that I've been involved in this, is how do we create more foot traffic in the downtown? And having this kind of a destination with multiple food establishments and multiple attractions is really going to be, I think, a big win for Reading.
Awesome. Just out of interest, have we heard from Starbucks, either location?
We have, yes, they're open.
Great. But outside tables and things, I'm thinking particularly down by the barbershop.
So they are a little bit constrained down there. I don't know that they have the space for them at that location. It's so tight with the parking lot. And I did see that they were doing some sort of curbside something there. I'm not sure what. The other Starbucks does have an outdoor patio, so I'm not sure if it's open, but I know that that's a huge resource for them. And we're working with them on some other items that they're working with Julie on.
Great, thanks. Any other questions from the board? Okay, Carla, you had your hand up before. I'm sorry, I think I missed
I
it.
was trying to do some math in my head, but what is the capacity of that tent, Jean? Seating?
48 seats.
48. Okay. Thanks.
Wow, great. Okay, thanks, folks. Let's move on to next item on the agenda is liaison reports. As I see people, I'm seeing Vanessa first on my window. Any updates for us?
I don't have a liaison report per se, but I did want to take just a moment of personal privilege. If others have liaison reports, I'll wait.
You know what, I'm just wondering, we're at 7:53. We're running a little bit behind. I wanted to get through liaison reports and public comment. Would it be okay after that, or would you prefer to be ahead of that?
No, I'm fine to wait until after public comment.
Okay, please, if I am not responsive, please kick me. Anne.
Sure, just would relay that HRAC was involved with the organizing of the Rally for Racial Justice this past Saturday, which was a very powerful, safe, and peaceful event. And I thank everyone who participated for giving voice to such an important issue in this day, time, and all times. And thank you as well to our public safety department, who went above and beyond to accommodate the rally. It was a really very powerful event, and it streamed on RCTV if folks didn't have an opportunity to attend in person. People present really seemed to listen to the guidelines of the organizers and those that the Board of Health indicated in a press release that they would recommend had they been ordered to approve anything. Everyone I saw there was wearing masks and engaging in social distancing. So it was an impressive event. Thanks to everyone who participated and did so safely and bravely. The ad hoc committee will be meeting again tomorrow night. Thank you.
Thanks, Ann. Karen?
I would like to echo Anne's comments about the peaceful event on Saturday. It was really well organized. And also, the governor has announced that anyone who has attended large events of that nature can now go and get tested tomorrow and Thursday, I believe. So you can go to, was it mass.gov/get tested? So I know I'm going to do that. Sounds great. Quickly, updates relating mostly to the Climate Advisory Committee. We have a plan from the Climate Advisory Committee to move forward on the methane gas audit. We are just looking for time to get back with Bob and really kick that off, and I'm hoping we can do that soon. And one of the reasons I am very anxious to get that moving is that during this peaceful march on Saturday, a number of us walked through a very large gas leak on South Main Street. Very, very large. So while I know National Grid is doing what they can do, we have some serious issues, and part of this project had to do with the tree. So for a lot of reasons, the consultant is ready to go, and I hope we can get that kicked off before the 4th of July. And then the other thing that Climate Advisory has been working with staff, lots of staff from Town Hall has been working on the Green Communities Initiative and organizing a meeting with all of the right people. And we thank Jean and Julie and their team for pulling all those folks together. So next Tuesday, hoping, with RMLD as well. So pulling lots of busy people into the right places and trying to get answers so that we can come up with a good strategy on how to move forward with a Green Communities application for renting. And that's it.
Thanks, Karen. Carlo?
Nothing to report. Last week is a full meeting of ASK for Karen and myself. I just want to commend most of the people on the screen who helped with town meeting. I know, Mark, you were part of the team that was putting that together, and Bob and Jane, and I don't know who else on the screen was involved, and Alan and Phil, and it was just, I was a little nervous about it, but it went pretty well. So I commend all of you for putting that together. Thank you.
Thanks, Carlo. A couple of updates from my side. So I'm the liaison to the Council on Aging. We had a meeting early last week. Very good discussion, very wide-ranging about a lot of things going on in human and elder services. Lots of contacts being made with residents. The team is doing a really nice job. I think the call count is over 5,000 contacts, not 5,000 people, but various contacts that are numbering over 5,000. Lots of other activities, very high awareness. The big concerns that seem to be coming up are about social isolation. And the Council on Aging is starting to brainstorm different ideas in terms of what they can do to try to help with that. And clearly with the senior center closed and probably having to remain closed for some substantial period of time, it is quite an issue. One thing that the council also brought up and came up at town meeting last night was the desire to have the director of elder services moved to a 35-hour position from a 28. And town meeting approved it, and Bob also responded to the Council on Aging's request very strongly, saying that he will make that happen, which is fantastic. I've received all sorts of little celebratory signs that came in the email today from all those involved. like Carlo, I want to thank the town meeting task force. I think did a really great job. The IT team, Kevin Furlow was fantastic. The town, schools, citizens, volunteers, employees. I think it worked very well. You don't quote me on this, but I would suspect we had record attendance. Yeah, must have been, because I counted like 186 at the peak, which is incredible. They're only 100. Is it 192 in total? 190 something. So that's fantastic. I also think we probably had a record completion time in terms of one night, and I thought it was very good. I know that the task force would like to get feedback from town meeting members, from residents, from anyone involved in terms of things that did work and didn't. But I think it went off very well. I think people had a chance to speak. There were very few technical issues. They all were tackled early on in the activity, and that was great. Two more quick things. I'm going to put up one quick slide. Sorry, if I can get to it here. From the Reading Cultural Council. The Cultural Council is very interested in getting feedback from residents. They have posted a survey. This is a link to the survey, but even easier, if you go to the Town of Reading website, the Cultural Council page, you'll see this survey. And what they're looking to do is to award funding grants to local cultural and arts programs. Last year they did 17 different grants. Clearly the delivery mode may have to be different this year. But they would very much like to get more feedback from residents in terms of what's going on. And then last for me, I too just wanted to echo that I thought that the rally went very well last weekend. I think it brought up some very important topics. I think it was managed very well. I would commend public safety also, both in preparation, but very importantly in execution. I think it went well. I wish that I could have been there, but I attended virtually. And that was great to be able to do that. And I know other people were able to do that as well. So thank you. Why don't we go, if Vanessa, if all right with you, let's just do public comment briefly, except, Jean, I see your hand.
Yeah, I think I did it in the chat. Maybe it didn't come out that good. But I just wanted to clarify, I don't know if I made it that clear, that we did basically approve Venetian Moon. So there's a couple of minor nitpicky things that will probably get resolved tomorrow morning. But the building permit is basically waiting for the tent company to come pick it up, and the tent is on the truck. So that tent could start getting erected tomorrow. Again, the last nitpicky things, I don't want to overstate it. There's a couple little things, but as soon as tomorrow, the team was out there this afternoon looking at it and making sure from a fire and public safety that it was going to be okay. So that's really good news. And I don't think I really made that point really clear. And I want to say thank you to Erin and everybody. So many people were involved in this right to the end to try and make this work. And our team really worked hard to get it together. So we have a draft license that's before the town manager, and we think we're there. So the other thing I wanted to clarify, I think I said 48 seats in the tent. It's 58 seats. So I just want to be clear about that.
It grew.
That's done up to.
Thanks, Jean. Comments, questions? Okay, let me suggest this. Why don't we move to public comment, and then I think we can move ahead down the agenda. So, all right. So Caitlin, if you don't mind, is Demetra in the waiting room?
She is not anymore. She was, but she's not anymore.
Oops. Okay. Sorry, folks. Didn't mean to run so long. Board members, we received a request to read a letter. So that was kind of in our old policy, and we kind of have moved to talking it through. What are thoughts about reading this letter? Is that acceptable? This is a person who was not able to attend this evening.
It's acceptable to me.
Yeah, that's fine.
Okay, I'm seeing nodded heads. All right, let's see.
Mark, the only comment I'll make is that we had already established policy not to read emails going forward, and if we do it for this one, we may be asked to do this again, which is something we had already agreed not to do. If they have a question or a general observation, perhaps we can go that route, but otherwise we're just going back to where we were 3 months ago.
I think that actually makes good sense. I would be happy to kind of give the gist of the letter simply and not read it and stay with that policy of if folks would like to attend public comment, we're happy to allow for that. Does that work for folks? Yep. Okay, great. So the subject matter of this relates to the VASC interviews on the Board of Health. And this note is really a discussion about what's appropriate for, this is, sorry, from Nancy Doctor, 371 Pearl Street, but it's a discussion of a question about the importance of knowledge, subject matter knowledge versus institutional knowledge. And it talks about how we have a Board of Health as well as a health department in different pieces. And it's indicating, sorry, I'm scanning very quickly trying to summarize this. It's talking about backgrounds of people and how important it is to have a strong background in public health, and institutional knowledge, though helpful, doesn't really help the committee move forward. I think that's a summary. Okay, Vanessa, let me accept your point of personal privilege and give you the floor.
Thanks very much, Mark. So tonight the board, later on in the evening, is going to be planning our retreat or discussing it in order to prioritize common goals. So I wanted to pause before we sort of head down that path to reflect on the key initiatives that I believe will bring needed focus on the commitment and accountability of this board and our town to situations that have long-term impacts to our residents. And this is especially relevant as we come out of the rally from this past weekend. Namely, I'd like the board to look at the quantitative and qualitative factors in our local government that will move our accountability to human rights and climate change forward. And these include town staffing, so examining and providing regular reports on how many people of color we have on staff, as well as defining steps needed to recruit and promote people of color. I'd also like to see a review of compensation based on gender. When we talk about climate initiatives, it was great to hear what Karen had to say earlier in the evening. I think we need a clear plan for working with RMLD, and this includes things like when we will be installing electric vehicle charging stations. We've heard a bit about some of the green initiatives the staff has been taking. I think those are great steps. But I think we need something more concrete, perhaps around greening our vehicle fleet as well as our buildings. Working more closely with Climate Advisory Committee for dealing with climate change is also something that I think needs to become more of a regular occurrence for the board. When it comes to inclusivity, I've mentioned this before, but having a gender-neutral bathroom in Town Hall, having a pride flag in June on Town Hall, and having a menorah on the Town Commons every December. So in my mind, these are more than symbols. They are a reflection of our community values and a reminder to us as town leaders of our responsibility to our residents. One immediate step that we could take, and I hope we do, is installing a Black Lives Matter sign in front of Town Hall. Timeliness is important here. We have seen the outcry of support for this movement from our residents, and I think this would be an important step. Last night, our town meeting members resoundingly supported the need for our community to acknowledge that we are allies of the Black community. And that commitment must be ongoing and persistent. So I've broached some of these topics delicately in prior conversations here on the board without moving the needle. So I'm hoping at this time and at this moment we can make these needed changes working closely with the town manager. I know that each of us raised our hand to volunteer for the board because we wanted to make a difference. So now is our time to act on our values. So I look forward to working with everyone in order to accomplish and move these endeavors forward. So, thank you.
Thanks, Vanessa. I think that some of the topics you brought up, I think we can talk through very well as part of the discussion of the retreat later today, and hopefully as part of the retreat. And some of them I think are a little bit bigger and different. And so we need to think a little bit about how the board wants to kind of talk those through. And again, I don't want to be totally reliant on this idea of a retreat, because again, it's now going to be a virtual retreat, but it is an opportunity for each of the five of us to express priorities, to see where we have agreement, to see where we have disagreement. And Jane was nice enough to provide us with a lot of information to look at. That for the three of us who attended the last retreat, it should look extremely familiar. For the two who did not, I think it gives you an idea of kind of how we talked about things. And I don't want to get into that topic yet because we've got time laid out for it. But I think that we should think about how to incorporate some of the things you're talking about into that discussion. And maybe it's a little bit broader than the things we had talked about initially for the retreat.
Mark, I think that's great. I think one of the things that I've seen is, we as a board end up spending a lot of time discussing issues, but I'm a little concerned about the progress that we're making, or perhaps not making. When we talk about the human rights issues, especially, like I said, timeliness matters. So I'd love to see action on these sooner rather than later, because I don't think these are issues that should wait.
Understood. I'm going to ask that they wait till the discussion of the retreat, but not longer. How's that?
Fair enough. Thank you.
Mark, I was actually thinking some of them might fit within some of our other agenda items tonight as well, like perhaps town manager goals and or future agendas.
Yeah, sounds great. And I think there is a lot of overlap between, as we think about town manager goals and the retreat, we talk about what it is we're trying to accomplish, how we can best come together with what kind of the town goals are for us as a board, and how that relates very much to our goals for town manager. So I think these all fit together. We'll have to, I don't know that we have to separate them. I think we can talk about them all together as we get to it. Let me suggest let's move ahead to the Metro North Region Housing Services Agreement, which is kind of the first item for us to take a look at and see if we approve this evening. Bob, do you have comments, or do you want to put that up?
Julie, do you want me to share the document? I'm going to hand it off to Julie Mercier.
Yeah, go ahead and share it, Bob.
Okay.
As you're doing that, let me ask the board a question. When we have our vast discussion on Board of Health, Eleanor is still with us here. Would we like her to stay on for that discussion or not? That's our choice. And I wanted to see if the board has a preference one way or the other. If we think we might be asking her questions, it'd be great to have her here. If that's not part of the discussion, then we can let her go.
If Eleanor is willing, I think that would be great, but I don't want to impose upon her if this would be sprung upon her with any surprise.
No, I was just, I chatted with Mark just to say if you all think it would be helpful, then I can stay on. But if not, then I'll go ahead and get off at this point.
Other thoughts? Vanessa, Carlo, Karen?
Mark, what do you envision? That Karen and I already discussed all these matters, and now it's in front of the board. So is Eleanor get to weigh in, or I don't understand what's going on?
I think it'd be more if anyone had questions for her, then they could ask them directly. But I don't, it's not necessary. And to your point, I don't think that we've not given anyone an opportunity to come and make a presentation to us. So I don't think that would be appropriate.
Okay.
So I'm just saying, yeah, if anyone has questions or is anticipating wanting to ask them of me, then I'll happily stay on. But otherwise, I will let you all debate and discuss, and I won't stay on.
Sorry, Mark, I lost the thread there for a moment. The sound went out. What is it that we are asking of Eleanor?
If any board members had questions of her when we have the discussion, she would make herself available. But if not, then there's the discussion was there's not an opportunity built in here for anyone to make a presentation tonight other than the VASC.
I think given the current situation with COVID-19 and the importance of the Board of Health right now, I would be curious, given that Eleanor is now the chair and that she served now I think 2 years, what her recommendations would be for what she would like to see for people joining the board, from the perspective of what we might need going forward. And I know this is unique. I know normally the VASC makes that presentation, or can feel free to speak with chairs of other boards, committees, and commissions, but this one I think is pretty critical given everything we're facing.
Karen, you haven't chimed in.
I'm trying to be sensitive to Eleanor's time. She's already given like so much. So, I mean, yes, it's that we're in unprecedented times and none of us are medical or science people. So it's hard to know when COVID touches everything. Is it an option to have somebody reach out to Eleanor so that she could maybe go have something to eat? And I don't know when we might need her. Would Eleanor be willing to be on demand if we need her?
I mean, my question is broad. As I saw the list, there's a lot of applicants for that particular board, and I would be, I've done some homework myself, but I'd be curious of what, as we look at this as an interview process, what do you think would be valuable for the community to have on a Board of Health?
So I'm going to interrupt there. I think that the right answer here is we're half an hour or more away from this discussion. Eleanor, if you'd be willing to be on call, if board members have questions, then let's reach out to you. And we're going to let you go right now, if that's all right.
Absolutely. Sounds great. And you have my, you can just let me know by text.
Okay, great. Thanks.
Thank you all.
And I inadvertently jumped ahead here. I apologize. We were to discuss outdoor liquor licenses first before we talk about the Metro North Regional Agreement. So let's stay on.
Mark, why don't you keep going? We're trying to find Venetian Moon.
Oh, okay.
Not here.
Very good.
In the meeting room. I think if you need to let her in, somebody.
Somebody needs to let Lisa in from the meeting room.
Okay. There's only one person in the waiting room, and it's not a name, so I'll let them in, assuming it's her.
I just called her.
Okay.
Mark, I've gotten complaints that my sound is bad. Is this any better?
No.
I'll see if I can find another headset.
Hi, we see someone who is on our board as Best M. Could you identify yourself, please? Oops. Hello, are you able to hear us? There's someone named Best M. Can we ask who you are? I don't think they're connected. Is there anything we can do? Caitlin, was this a phone number?
Nope, that's just how it came up.
Ah, okay. Best M, can we ask you to identify yourself, please? Let's try a text. So let's give it just another second here. If it doesn't connect, I think we'll go back to the Metro North Agreement.
Oh, there she is.
Yep.
There we go. All right, we have video, but not audio.
Lisa, is that you? That's Lisa.
Hi, Lisa. Are you able to hear us?
Yes.
It still says connecting to audio.
There you are.
There you are.
Hi, sorry. I needed my 18-year-old to help me out. Okay, sorry.
All set. Good.
Thank you. Welcome to the select board meeting.
Hi.
So Julie, do you want to take it from here? Or sorry, I'm on the wrong. I'm back to Bob. Sorry about that.
Yeah, I'll do that. Let me first share a screen. Hopefully the board can see. We have a draft motion, and then I'll come back to Lisa. Move to approve the extension of Venetian Moon's liquor license to their outdoor dining area, subject to the following conditions. A, recommendation of an outdoor dining plan by the expedited approval team, which you heard about earlier. Approval of such plan by the town manager, which I'll do in the morning. And then the sticky point C, subject to legislation or clarification that the 2-week notice for a public hearing is waived for this purpose. So let me stop sharing and just talk. The board, as well as Lisa, saw a write-up over the weekend about the confusing situation we're in. The executive order that was issued intended to waive the 2-week period so that the local licensing authority, in this case the select board, could simply have this discussion as we're doing today and approve something. Unfortunately, there's a defect in the executive order, and right now, without remedy, there's still a requirement for 2-week public hearing notice. So we've done two things. We thought the applicant should come in today because there is pending legislation, and gave me an update. It's with House Senate Ways and Means. As soon as it passes, if it passes, if you approve a liquor license tonight, then it's valid. As a backstop, we have a time set on the June 30th agenda where it could also be valid. I'll also go out on a limb and say if you approve it tonight, I don't have a problem with us issuing it tomorrow. I spoke to Representative Jones today, and he indicated with certainty that this would pass and it was a mistake. And he indicated that there would very likely be no consequences of someone that went ahead and did it, as many other communities are doing. So there's peer communities around us that have actually delegated the authority to issue a liquor license to the town manager or administrator. And that is clearly not in the legislation and not allowed and not intended to be allowed. But everyone is kind of like, well, the businesses need to survive. Let's just do whatever's easiest. So I'm generally good with that, but I do think you are the local licensing authority and you're the ones that need to give that permission. That's why I added the language in the motion, subject to legislation or clarification. Honestly, I will talk to town council, but I believe I got enough clarification today that I'm comfortable with you approving a liquor license and it being valid as soon as you do. So it's an unusual situation. Town council is being especially careful in going by the letter of the law, and I appreciate that. Sometimes you just need to take a step away from that and do the right thing. Town council has also given me assurance that there is pending legislation to basically forgive anyone who didn't follow the exact rules, and that there will be no liability for employees or for the town as long as they use best practices and the best information, because there's lots of things going on right now that people are just doing the best they can. And I'm not a stickler for details, but as the person in charge of government, I am supposed to follow the rules. So it's a little bit of an unusual circumstance, but I'm willing to work with the applicant in this case if the board is willing. And I don't mean to put you on the spot.
Bob, what's the clarification you got today that made you feel comfortable with this absent?
That it was a clear, this is also from the Lieutenant Governor today, it was a clear oversight. It was not intended. The ABCC and the administration clearly intended to waive the 2-week notice. And it was literally just a, if you will, a typographical error that led to a version that didn't do that. And so that's a very minor piece of that bill I mentioned to clarify. You saw when, if they engrossed it on the 3rd, they caught it pretty fast.
So that means that the ABCC has no intention of going after anyone.
That's correct. The ABCC just wants to get complete paperwork after the fact. They will not enforce, they will not chase. So it's not perfect. We can't be perfect right now. And, you know, to be completely safe, I heard this morning, Lisa, that you were willing to open, you know, subject to the tent being put up without a liquor license for as long as it, well, not for as long as it took, but for a few days or a week, if that's what it took for the legislation. So that's something I can work with you on tomorrow also.
I appreciate all that. That sounds amazing. And I do thank you for considering all that.
Mm-hmm.
But what are the other requirements? Sorry, go ahead.
I'm sorry, I just don't know what Lisa heard earlier, that, you know, effectively your permit is virtually on my desk, not quite, but you'll get it in the morning for the outdoor dining.
But what other requirements are there, neglecting the timing issue, assuming that the legislation is remedied? What are the other requirements, and have they all been satisfied in terms of?
Yeah, they've all been satisfied by the other process we use just for the outdoor dining. One of the most important ones, I guess from a public health standpoint, is that if you use a tent, it not be enclosed on 3 or 4 sides, that it has to be open to allow the air to circulate. And then all the, you know, liquor license rules and requirements of inside just move to outside. It's not complicated.
Questions from board members?
No, I'm ready to read the motion.
Just one question before that. In terms of, sorry, so we went through all the requirements. Those were met. This would extend from now through November, is that correct?
I did want to ask Lisa that question. I saw some correspondence that you might only be interested through August or September. Do you have a definite time frame, or is it just, let's see how it goes?
I think it's let's see how it goes. I mean, typically there's really not much of an interest. Usually after Labor Day, when in the cooler months, you know, then you have to start bringing heaters out there, and
right.
It's a little tricky. I guess we'd have to see how it goes, but I really honestly didn't plan on it to anything after maybe the beginning of September.
Okay.
And then I don't know. I mean, I don't know. I think we really need to take it, you know, month by month, because if these businesses are able to open up more, I also would like to free up the parking. That's truly, I do have a concern about that as well. I know right now it's not a need, so I wouldn't want to take up the parking during those winter months if these businesses are able to, you know, allow more customers into their businesses as well.
I appreciate that, especially that's one of the complications Gene didn't spend a lot of time on, but you know, taking away a parking lot from several businesses is why you need to ask several businesses, are you okay with that?
No.
And since some of them have access through the rear, I'm not too concerned about those. And, you know, the majority of the rest of them have worked with you pretty well, I'd say. So you know, again, I'm perfectly fine that everything looks good. Gene can remind me, the outdoor dining and the state legislation, one's a November 1st date, one's a November 30th date. I don't think we have to put a motion in, a date in the motion, so the liquor license can just survive as long as you're doing outdoor dining. And if it's going to be before November 1st, that's your call. And certainly we'll work with you as needed.
Gene, can you just remind me, what's the sidewalk access? Are people able to walk at all on that inside? Is that an open area, or is it just now going to be the outside back to Main Street to get sidewalk access to get to that area?
So one of the things that we're looking at is the Jersey barrier that's going to basically close off the area at the Woburn Street entrance and then at the Main Street exit. And so you'll still have the crosswalks there. The Jersey barriers won't interfere with that. And the sidewalks will be free. This tent is going to be located in the cobblestone.
Okay.
So it's in, basically, we're taking away the parking spaces, but keeping the sidewalks.
Great. Thank you. Any other members with questions? No? Okay, Carla, we're ready for the motion then, please.
Okay. Move to approve the extension of Venetian Moon's liquor license to the outdoor dining area, subject to the following conditions. A, recommendation of an outdoor dining plan by the expedited approval team. B, approval of such plan by the town manager. And C, subject to legislation or clarification that the 2-week notice for a public hearing is waived for this purpose.
Is there a second?
Actually, I have a comment. Mark,
Okay.
sorry.
Actually, we need a second first, and then we can come back. Can someone second, please? And thank you. All right, Carla, go ahead, please.
Given what Bob said, is the C cover that you can approve this tomorrow?
I'm sorry, Carla, would you ask again?
Does the provision C cover this motion if you approve this tomorrow without clarification, as you mentioned, because it was a mistake?
No, I have the clarification. As long as A and B are met, I think there was an outstanding electrical permit issue, which was considered minor. As long as A and B are met, I think C is fine. You know, especially, it's a technical error. Okay, that happens. You're speaking to a restaurant owner who says she may have a 10-week season, and to penalize her for 2 more weeks just sort of doesn't pass the common sense test.
No, I agree. I 1,000%. I just want to make
Yes,
sure
it does that.
Okay, that's all I wanted to make sure, that we didn't have to, some glitch would see as relative to the 2-week notice. That's all.
I won't read any emails between now and the morning, just in case.
Any other questions from the board? Seeing none. Okay, we will do a roll call vote here. Anne?
Yes.
Karen?
Yes.
Carlo?
Yes.
Vanessa?
Yes.
And Mark, yes. So we are 5-0. Lisa, you are all set.
Thanks, Lisa. We'll be in touch.
Thank you so much. I really appreciate all your support. Thank you very much.
Thank you and good luck with it. I hope it
Thank
goes
you.
very well.
I hope to see you all. Thank you.
You bet. Thank you. Okay, now Metro North Regional Housing Services Agreement. Julie, thank you for your patience.
Sure, thank you for having me. Bob, are you going to pull it up again, or?
I'm still having town meeting fatigue from sharing documents. So there you go.
I can't imagine. So the Metro North Regional Housing Services Office is the sort of housing consortium that we are the lead municipality on. It's a group of, it was established in 2015. It's a group of 4 towns. We're looking actually starting July 1st to add the city of Woburn. This document is a document you've signed, you sign every 2 years. We really just update the dates in it, and then we look at the budget. We look at the hours allocated to each town by percentage. We track them every month. We track them every year. We adjust the percentages as needed. I've coordinated with the other 4 towns on the proposed budget. And I think it should be pretty simple document. It's good value for the money. I think most towns would agree with that. The agreement and the contract give us access to a housing consultant, which is excellent. Also very good value for money. It's been a great way to show the state that we are a leader in terms of housing and the housing goals coming down from the governor's administration. And I hope that you'll support it and continue to sign it. Thank you.
Thanks, Julie. Board member questions? Not seeing any. Great. Okay, Carla, can you read the motion, please?
Okay, move to approve the Metro North Regional Housing Services inter-municipal agreement as presented.
Is there a second?
Second.
Thanks, Vanessa. Any board member discussion? Nope. Seeing none. Okay. Let's take a vote. Karen?
Yes.
Carlo?
Yes.
Vanessa?
Yes.
Anne?
Yes.
And Mark, yes. We are 5-0. Is this one of those agreements that needs to be sent out to each of us to sign, or is it going to be a moving PDF, or how does this get done?
Yeah, I haven't coordinated that with Caitlin, but this is the second document that does require your individual signatures. The other was the speed limit on Haverhill Street, which is on Caitlin's seat at her office right now. So we'll have to arrange for you to sign these, hopefully in the next week or so. And Caitlin can figure out how. You individually do have to each sign it.
Okay, we'll work out details. Okay, great. Thank you very much. Okay, next, let's move to the cell tower, water tank cell tower discussion.
I'll just start with a quick overview. Ryan, do you want me to share the documents, or do you want to do that? Easy for me to do.
I can try sharing the documents. I can try sharing them.
Okay.
See how it goes.
I did a quick write-up a couple of years ago, a few years ago. Town staff was in, as you'll see, there's been 3 or 4 presentations to different boards over the years on this issue. The long and short of it is that we followed the latest guidance we got from the select board, or the then select board, and have had no luck following that path. And so we need to come back to you and have some further guidance, whether to continue down that path or whether we have alternatives. And I will say the only significant change since we started down this path years ago is our building security study did evaluate this structure and strongly recommend that no equipment be on this tank from a security standpoint. So when maintenance needs to happen on the telco equipment, it's a separate structure with no access to the water supply, which obviously makes sense. So at that point, I'll just turn it over to Ryan for more details.
Thanks.
Thanks, Bob. Thank you, Mr. Chair and Select Board. I'll try to make this really brief because this project has been going on since 2012. And we're at this point, which I think we've exhausted all the options, right, Bob? So I'm going to go through briefly. You're going to see a project update slide, and then I'll go through just a few background slides so you can see what's currently on the tank, and just for some of the board members who haven't seen really what we're dealing with the cell carriers. You'll see basically what we want to talk about tonight is the section in blue. From the conception of the project, we've hired an engineering consultant to help design the new tank. We've moved forward and had a consultant help assist with the cell tower. They're 2 separate sort of entities there. We've met several occasions with the select board. We've gone through some life cycle cost analysis, and we've got to the point where we passed an article in April of 2019 to fund the water tank. The tricky part becomes where we get into the cell carriers and how they are attached and adhered to our tank currently. Back in the 1990s, it was a great source of revenue and everyone thought it was a great idea. Well, fast forward now when we have to maintain the tank or take it down and replace it, we come into the situation of what we do with these cell carriers that already have a presence on the tank and in the surrounding area for coverage. We tried to put out an RFP from recommendations and discussions from previous boards that would allow the carriers to bid on putting up a temporary cell tower to move all the equipment over. And also in the RFP, which was very craftily written by the procurement agent and town council, was to, in order to get this so someone could be awarded a bid, that had to be based on a bottom line, and that was leasing and leasing agreements and what they were going to charge the carriers to be on that temporary tank for a portion of the period of time. So it was pretty ingeniously written. However, there was some pitfalls with the carriers. A lot of the carriers didn't meet the requirements of the bid. Some ignored the bid requirements and made their own requirements. We had a company come in and just say, we will put this up for 40% of the profit and 40% of the profit after it's taken down for what's on the tank, which we own. So we considered that to be non-responsive bids and threw that out and said, it's time to go back to the drawing board and really meet with these carriers. It's important to note that we are in a holdover period with these carriers, and I suppose we do have the option of asking them to leave the tank, but that would cause a lot of, I think, trouble for us in the long run, and we don't really want that to happen anyway. We don't want to lose coverage. So here we are, a few meetings down the road after the RFP, and it seems to have come back to the point where we really need to discuss funding the temporary tower and keeping it separate from any leasing agreements that would subsequently take place on the new water tank, if that's where we wanted the carriers to go onto, or if we really wanted to have the discussion of making that temporary tower permanent. There's really no distinction between the two. I want to make it clear that the temporary tower that needs to go up will have to be designed in such a fashion, because it is on town property, to meet all loading requirements. So we have we reduce our liability. That would mean that the temporary tower that goes up will be pretty substantial and will be similar to a permanent tower. The only difference will be the foundation will be removed, or the temporary tower will be taken down upon a period of time that it takes to put the water tank up. So that's the question really that needs to be discussed on proceeding forward and allowing the town to fund relocating the cell tower either by temporary means or permanent means, so we can get this water tank project moving, which is very important. It needs to happen very soon. I'm going to go through the next slide. I can at any point stop and ask any questions. I'm just going to go through the next couple slides. They're relevant but not pertinent, but they do give you a little sense of history.
Brian, can I ask
so the
you?
water? Sure can.
Sorry, this is Mark Doxer. Just want to make sure I understood correctly what Bob had said and what you had said. What I thought I heard is that the tank and the cell tower have to be separated. And I'm trying to make sure I understand what that means. Does that mean if we build this new tank, can it in fact have cell equipment on top of it?
So to what Bob is getting at is from the security study. And Bob can probably talk a little bit more about that. But my understanding is, and I can talk to you from a tank perspective, is that to have cell carriers be on your tank, that means that now you have cell carriers and their personnel having access to your tank. This has happened since the 1990s. It's not ideal. It shouldn't happen. If they can be separated, that's ideal. Same thing goes for cell carriers and their equipment. They don't want to really have town personnel being in and around their equipment as well. So when Bob makes the comment that they need to be separated as far as that's concerned, that is true. The tank, I will just clarify, structurally, the tank can be designed so they can go on the tank. But if you're looking at it as a security standpoint, they should be separated. I hope I didn't muddy the waters there.
No. I think that from my perspective, that clarified it. So is the discussion tonight that there need to be two separate towers, one for water and one for cell equipment? And maybe I'm going too far, but you'll correct me in a moment. It sounds like we need two separate towers to be established here. One to replace the current water tank because it needs to be, and it's too expensive to maintain and paint. And the second is that if we want to have cell towers, and I don't know what the contractual time length is, but if we want to have cell towers, we have to construct or have constructed a new physical structure for that.
So we could continue proceeding down the road of doing a temporary structure and getting them off the tank for a short period of time so that the water tank can be constructed. That's one option. The permanent option would separate both the two, so the two separate entities, and would have a permanent cell tower adjacent to, in the same location that that temporary tower would be on the site. So I don't know what, Bob, you know, I don't know what type of discussion we want to have tonight, whether we want to fund, you know, the tower in some fashion or come back to this at a later date, but do we want to discuss permanent versus temporary?
I think from the way I see it, the original path we started down was to get the equipment off the water tank permanently, and we would ourselves build a structure that would hold all that equipment, which, by the way, also includes the town of Reading equipment near the top. Very important for our public safety. In your packet were some letters from a couple of fire and police organizations that also really wanted to be on the top of a tower like that. It's in an area where there's some definitely gaps in coverage for some of the cell carriers. So that seemed like a good angle from a couple of reasons. One, for security, to keep the two things separate was pretty obvious. And then also, we are usually in a position as the town where we have cash, we have free cash, we need revenue. And building a tower ourselves and then signing leases with the organizations that want to be on it are the most lucrative annual cash flow. If the organizations themselves are going to be forced to build the temporary tower, then they are going to take that out of the money they would have otherwise paid you for a couple $100,000 or so. So from a non-financial standpoint, having two independent structures was better, and from a financial standpoint, it was better. But a couple of years ago, at a meeting with the select board that I was not able to attend, the then select board directed staff away from that option because some neighbors complained, and not to re-litigate the whole argument, but you know, it has to do with how safe different waves are in different locations. And there is equipment there now. There is going to be equipment there at the end. It's a question of if it's on the top of the water tank, it's a certain distance away from the neighbors. If it's going to be in a standalone tower, it's going to be further away from those neighbors. So it's going to be a little more of an eyesore, but from a safety standpoint, one would suppose if it's dangerous now, it's less dangerous when it's further away. So really what we need from the board tonight, if you're willing, is some kind of guidance to, are you open-minded to us reinvestigating that first path, which would have two separate structures? Now, in the capital plan approved last night, there's $100,000 for this project. There's also another $100,000 for town technology. My recollection a few years back was we actually had town meeting approve, I think it was $300,000 to build our own tower. Whether we can cobble it together with the funds approved last night is up to the town accountant to determine. But we would only go down that road again because we are unable to follow the direction of the board a few years ago, and come back and ask you if you'd reconsider that path.
Got it.
Because realistically, it seems like the only alternative now is to throw them off the tank.
Right.
They can't comply with building it themselves. If you ever want to see a decision that you'll get a lot of emails on, it'll be about everyone losing their cell phone coverage in Reading. It would be pretty significant change to lose this coverage. And obviously we don't want that.
Right.
So it's a bit of we're kind of boxed into a corner in a way.
Right. And if this board was to give you guidance that suggested a second tower, I'm trying to understand under what circumstances a temporary tower would make sense. And I'm not coming up.
It wouldn't.
It wouldn't.
It wouldn't at that point. What the reason why I had that discussion is because that this is the final steps the last board had us go through, and we really hit a roadblock like Bob just clarified. And so we're at the point now where we need to fund the tower, and we need to have guidance on whether or not we go for a permanent structure.
Got it. And just going backward for one more second, and I'm sorry I'll let everybody else chime in. Sorry, I'm just kind of pushing this for a moment. Back to the discussions before, a temporary tower, no matter who funded it, would still have the equipment on it, and any concerns that people had didn't go away. So, okay, so at the end of the day, you're asking us to come back and say, would we allow us to look into a permanent tower that would be higher, that would keep the waves higher and away from the residents? I assume would have more capacity if it's a dedicated tower, so that we could go out and potentially find other people that would want to put their equipment onto here. We know that there's information from some telephone companies, there's information from emergency services. Do we have a feeling at this point that, as compared to these small cell solutions that these telephone companies are trying to address, they still would prefer to have this larger system?
Yeah, I asked that question a year or so ago, and there is absolutely no crossover there. That this has nothing to do with 5G. They need this regardless.
Right. They run on what they call macro and micro sites, and this is a macro site that handles a lot of their traffic. And so the small cell sites handle a lot of the high-speed traffic for 5G, and they're closer together because they don't go as far. So they need this in their system. They've never said that they don't need large cell towers. And there's a little bit more information further down in the slides that we'll just show you quickly how they expand their coverage. But they certainly need a macro site like this.
One more question, then I'll relent. In terms of the length of agreements we already have in place with these various carriers, are they short-term, long-term? When do they expire? When do we have to renew?
They're all expired except for one, Bob, T-Mobile, that was just recently done.
One which is almost expired, and the rest have all just been sort of automatically renewed rather than
right
away.
And do we feel pretty confident that if we build this tower, they'll all come running? They'll all want to make sure their equipment's on it?
Absolutely.
Yeah, I'd say the only risk is consolidation in the industry. So if we had space for 3 and there was 5 interested, there might only be 3 interested by the time this is done. But they'll still have demand.
Yeah. I'm sorry, Vanessa, did I cut you off? Sorry.
Thanks, Mark. So I have 2 questions. One, did I hear correctly that you said that they don't like to be on towers with our equipment and vice versa? Did I hear that correctly?
Not as far as antenna goes, but they don't like to be on like a water tank and vice versa. They don't mind having public safety antennas on top.
I see. So if there were to be a separate antenna, there's no concern about them having access to our public safety equipment on there?
No.
No. It would be access, but there's no concern about that whatsoever.
No.
Okay. Thank you. And then from a maintenance perspective, we're essentially talking about constructing 2 towers that now the town needs to maintain, operate, and replace at some future interval. So what is going to be the anticipated cost of future maintenance for the second tower, and will that be balanced off? Well, are we essentially going to be back at net zero, or are we going to be, because of the lease contracts, or is it going to end up costing the town more in the long run because of maintenance and replacement? Thanks.
Just to be clear, the 2 towers are quite different. One's $300,000, one's $4.5 million, just to start with that. The water tank, by changing the material we're purchasing that does not require painting, should last for 50 years. Who knows? It's just been around for, correct me, Ryan, 10 years or so. So no one really knows.
Yeah, maybe a little bit longer, but it hasn't hit its life cycle yet, so no one really knows.
It's meant to be very long term. And I've never heard of a town that put up a cell tower that is looking at replacing it during the last 15 years. So as long as you do a reasonable job on that and it's not damaged somehow, there's really not any significant annual maintenance at all.
And again, there are companies that come in and can do an annual maintenance and safety check on the towers. Bedford, the town of Bedford, just completed a project very similar. Granted, in an industrial area, but very similar.
And we had them explore every part of town for another location that wasn't residential, and it just doesn't exist.
That's helpful. Thank you both. And my last question is, if we are seriously considering putting in 2 towers, out of consideration for the neighbors, could we provide some kind of, whether it be natural or something else, barriers so that, from a beautification perspective, so that the neighbors aren't dealing with sort of the additional eyesore? The rest of the town benefits, but they get stuck looking at it every day.
Yeah, if we go through the design. Go ahead, Bob.
No, just our initial design had considered a lot of mitigation on the ground.
Wonderful.
Karen, did I see you had a question?
Yes, please. Thank you, Mr. Chair. Sure. I didn't see any cost benefit analysis on the tower. I think that would be helpful for everyone to see when and if this tower would pay for itself. Looking in terms of designing I'd like what I'm hearing about the water tower being less maintenance and long life. So I'm specifically talking about the technology tower, if you will. And I share Vanessa's comments that I'd like to look at designs that minimize visual impact on the neighbors. And then I would also like to see the cost benefit. I don't know how, I assume these leases are worth doing and they generate great revenue. So it would be helpful to know when the tower would be paid off by the leases we had, even if we're just planning on the minimum, and life cycle cost about the maintenance of the tower. And then one quick question about both of these towers. Do these towers need to be powered by anything? There's electricity running out there, yes?
We already have infrastructure in place for both, for 3 of the carriers. There's the potential of a 4th carrier, and as Bob mentioned, there's some consolidation that's probably going to happen relatively soon. So there is power there is fiber there, and then also for the water tanks, minimal power for that. It's it'll have SCADA attached to it, so we'll need some power for that, but very minimal. It's already there.
Okay, I'd be looking for just making sure we ask about low carbon options. Maybe, that's a big tower. Maybe you can power something by battery backup or a solar, or just everything we think about doing. We should just get in the habit of asking those kind of questions. Thank you for the update on how that's powered. Appreciate it.
Sure.
Yeah, I can answer the life cycle cost. I think you're probably just interested in the cell tower, but the water tank was pretty compelling. If you have a 50-year horizon, you save millions of dollars, which you have to have a 50-year horizon. The break even on that was somewhere in the 20 to 25-year point, because it is more expensive to buy the water tank we're looking at. Had to be a little more careful with the leases because it is a negotiation, but I'm pretty comfortable saying the break even would be less than 5 years.
And did you have a question?
No, I'm good. Thank you.
Oh, sorry, I saw you unmuted. Carlo, any questions at this point?
No, I'm good. It just seems like, I don't know who negotiates with these carriers from the town, but it seems like they're not doing much these days, or is it they don't have an incentive? I know some of these contracts are expired, and what is built into these contracts when they renew for the increases? Is it a standard increase of percentage, or just everything is negotiated every renewal?
Yeah, I'd say everything's negotiated, and we're not in a particularly strong point right now where we're dealing with expired contracts. And we're also asking them to spend, a few $100,000 in order to have the permission to come back. So their incentive, not to digress too much, but all these carriers are chopped up into lots of business units. And the business unit we're talking about has no incentive whatsoever to build a tower. That's someone else's department. So that kind of cuts to the chase of the issue. They are not acting as an organization, nor should they. They don't want to be in the business of building these towers. They think that someone else should do that for them, and then they should put equipment on them.
Okay, thank you.
I will say the carriers have been very they've been working with us every step of the way for the most part. And they've been very accessible. So they're willing to offer up whatever support they can.
Can I come back just for a moment to Karen's question? With a water tower that doesn't have any electronic equipment on top, can that have solar cells?
I'm sure we can look into some solar cells being placed on top. It will change the aesthetics of the tank. I mean, keep in mind that tank is a little bit stouter and bigger, and it casts a little bit more of a shadow than I would say like a cell tower, so they can be open. But we can look at those options for sure, definitely.
Cool. Thanks. Sorry for interrupting and then leading the rebellion.
That's okay. If it pleases the board, I can just go through the slides quickly so you can get a sense of really what's up on top of the tower for those who haven't seen it. I think we've done the relevant discussion already, but it'll just give you a little bit more background. I can skip through this. It's just some information on the water tank. It's 750,000 gallons, and we've already been through this before. This is sort of the catwalk up on top of the tank, and this lends to what Bob and I have been talking about as far as security. As you can see, it not only creates an OSHA issue for us with all those cables up there and a structural issue, but they have access directly to our catwalks and to our tanks. So there's some more crowded areas, some cutting into our catwalk. And those are the cables coming down. So it's pretty significant when you really get up close and you start looking at it. And that's an existing conditions plan here. You'll see the big circle is the current tank, and the small circle is the old rocket, if you remember that. And that would be the proposed site as we know it. We're pretty limited in where it can go.
Ryan, what happens to the old tower?
I'm sorry?
What happens to the old tower?
So what happens is, because we have two towers, two water tanks in town, we have redundancy. We not only have redundancy in the water tanks, but we have redundancy in the northern intermediate high loop that comes through from the MWRA. That was the Oak Street project. Very critical project for not only our community, but surrounding communities, and it provided us redundancy. It was very, very important that our community allowed that to come through, so it was a big project. That also allows us to shut down one of our tanks, specifically Auburn Street, take it offline, demolish it, remove it in place, and also install a tank right back in the same footprint. It's very rare that a town has that ability to do that.
And does that require us to, while we keep this original tank, do we have to repaint it and do all sorts of things to it in that time?
No, and so this is why we'd like to expedite this project a little further. We've been trying to get this. So this project has been a project since 2012 for painting. We kicked this can down the road maybe 3 years or 4 years. Before we did the life cycle cost analysis, we were getting into same issues with the carriers getting off the tank. At that point, they were still under lease agreement, so it was a little bit more difficult. When we did the life cycle cost analysis, maybe a couple of years ago, like Bob was saying, it was around the 20-year mark where it really was evident that to put a tank in made a lot more sense for the cost of painting. With us having never to really have to maintain this tank in any fashion considerably with painting in that 50-year period. So it was pretty evident when you looked at that breakdown. So I hope that answers the question. I don't know if I answered that, but
so the plan is not to take it down.
No, the plan is to take this down in place, get rid of it, and put a new tank in its place.
Oh, I'm sorry. So this proposed new tower is the cell tower in terms of location on the map you're showing right now.
Okay, so we're talking. Okay, so this. All right. I guess I was confused there. The tank is going in that big round circle in its place. The square that we have showing there would be the area that we would designate for the tower.
The cell tower.
The cell tower, correct. Sorry, it gets confusing.
Thank you.
Dealing with this for a few years.
Thank you. Got it. Why don't you go ahead and finish those things, your slides, and then.
Just quickly here is you'll see that center dot in the middle. That's the site for the cell carriers, and this is just AT&T's propagation map. This is the existing conditions. It'll be pretty evident as soon as I click to the next slide how big all the green areas get. So that's the existing, that's the proposed. And that is a cell tower, I believe, at 165 feet they used as a height. And then this goes into some of the old slides from the water tank. So I think we can stop here.
Okay, questions from board members? So I think that, make sure we understand. So you're asking us this evening to, I guess, bless an approach that would look at creating a permanent second tower for
Correct.
Permanent cell tower. And
Correct.
Okay, and our goal, no matter what, is we're going to want to get those the cell towers off of the water tank for security reasons. We have an issue with the water tank itself in terms of maintenance, painting, etc. And the advantage of the path that you're asking us about is we'll get more safety, better cell coverage, opportunity for more vendors to get onto the tower, take care of our security questions, kind of all good things. And it sounds like it even addresses a lot of the concerns that people had before about the issue of where the cell towers are located, or where the antennas are located. So I think from my perspective, this sounds pretty clear that we should be exploring this in terms of the town looking at a permanent cell tower. How do other people feel?
Mark?
Carl?
Yeah, I agree. From the security standpoint alone, is a big red flag for me, and that was mentioned in the security plan that was devised for us specifically. So that, and we have some more control, I think bodes well for the town. So I think with the considerations that Vanessa and Karen made about aesthetics and possible solar, I think we should let the town move forward. That's my opinion. Thank you.
Thanks, Carl. Ann?
I'll echo that. Thank you.
Thanks, Ann. Vanessa?
I agree. Let's move forward. We've been kicking this around for years. If they need something from us, let's give them the green light and have them go.
Karen?
I agree. Let's do it.
Okay. So it's certainly a consensus of the board. Was there a motion related to this, or is it more feeling of the board?
I don't think there's a motion needed. Thank you. Ryan, get the tank put up tomorrow.
So Venetian Moon will be open tomorrow in the tanks tomorrow, both. Right.
So this will still be a process for a little while, but it's good to have this direction. Thank you. I think this is the direction that made the most sense.
Yeah, moving forward, you'll see some photo renderings and things like that of what it's going to look like.
Right. Yeah,
and we'll be in front of you again.
Great. Thanks, Ryan. Thanks for the presentation.
Thank you.
You bet. Can I suggest it's we should take about a 10-minute break. It's 9:08. Can we come back at 9:20? We'll take just a quick break, stretch, and then we'll come back at 9:20, and we'll go right into appointing volunteers, the BASC.
Okay. Thank you.
have a discussion about any committee or any appointee that you've proposed. And especially if they want to pull out that from the consent motion, if you will. Because I know that happened in the past because someone wanted to pull something out. I don't remember the reason.
I mean, currently in the Board of Health are blank, so there's nothing to approve there.
Why don't we?
Right, that was the only one that had you guys didn't agree on, so.
Exactly, so I don't know if
I
we need
left
to
it blank.
pull it out, or we just say as presented, and that automatically, since we didn't put any appointees forward for that one, does the
Just say
secretary?
not including the Board of Health.
Okay.
Be safe.
What do you guys think
You
about
might, you might appoint 2 blanks.
Let's come back to order. Phil, I don't know if you're able to hear us.
Okay.
We're
All
back.
right.
We'll go back. So select board is back in session. Thank you. So before we move on to the appointments, I do have a question. We're an hour behind as of right now. And still have a lot of stuff to cover. I'm wondering if folks would be amenable to, instead of trying to jam everything in tonight, to have another meeting. And I appreciate it. It's adding to everybody. On the other hand, it'll allow us to get to the executive session tonight and then come back and take the other item. So I think what I would suggest is we would do the full VASC, then go to executive session, and then come back and take up the rest of the agenda at another date.
The only difficulty with that would be Jane's schedule as a selectman in another town. So it's not automatic.
Got it. And so next Tuesday, I made a bad choice and I booked a bunch of meetings, but I can ask Jackie to unbook me and see if she can move it. But I think we're not going to get through this whole thing tonight at a reasonable hour if we head on. What are folks' thoughts? Would you rather have another meeting?
I think you should really try to tackle some of these tonight and understand what work there is to be done. Because as I was saying to you, some of these is going to take some thought over a period of several weeks, both from the thinking and letting the time go by. So I'd hate to see you give up 2 weeks, if that's what it came down to, or even a week, without at least having some of this discussion. I'm specifically talking about the retreat, not so much the town manager goals or the review process. I think the sooner the 2 members get integrated into the retreat thinking, the better off you'll all be. That's my one comment.
Other thoughts?
All right, just to clarify, we made the comment about Jane's schedule because specifically for retreat planning, right?
Yes.
Oh, okay, yeah. Can we promise, can we promise the next meeting won't be 4 hours?
So, Mark, I have a suggestion.
Please, Vanessa.
Okay. So I appreciate the effort Jane has put to help guide us through this. I think it's been valuable, especially as we saw in the previous one. Might I suggest, Mark, to your point, that we do have another meeting next week. If you're booked on Tuesday, maybe we could do Wednesday. I realize it's sort of off schedule, but I think people might be used to that right now. Assuming, of course, that Jane can join us. Otherwise, we can perhaps revisit another day. I'd also like to make more of a general comment, and we can go into this more for the retreat, but we have some wonderfully detailed presentations that the staff put forward. However, perhaps in future meetings, starting perhaps as early as next week, we could ask if the staff could make much shorter presentations with everything being included in advance. So if we have questions, we can raise it. But I think we're spending a lot of time going into a lot of detail on things, and it's slowing us down. And this is not a recent thing. This is an ongoing thing. But that's my friendly suggestion.
Let's parse that into 2
That
pieces.
we end before 11.
Yeah. I think let's parse that discussion into 2 pieces. One is there's a suggestion for shortening things in the future. The other is related to tonight and the timing for tonight and seeing what we can accomplish. My gut is that the retreat and the town manager goals may be tied together. I'm game to see where we are after we finish the volunteer, the VASC. I just don't think we can cover it all tonight.
Yeah, I'll add, Mark, that we were all on town meeting until quite late last night. So I don't know about everyone else, but I'd like a reasonable bedtime tonight.
So why don't we move ahead on VASC? Let's see what time we're at, and then let's have this discussion. Does that
Can I
work?
just ask a question just to clarify? When you mentioned having presentations in the packet, Ryan's was in there. Jean's was not because it's a developing issue. Is that really what you're referring to? Sorry, we can't hear you.
You're muted.
Sorry, I said I'll defer to Mark, but maybe we can table that.
Yeah, let's save that one for later. But my gut is that it relates probably to the bigger formal presentations. If we already have them, that's great. And let's put the responsibility on the board members to read through and come back with questions and ask. Perhaps we can ask staff just to kind of take, as Ryan eventually did, just take kind of the highlight slides and then stop.
Last week, when poor Jane and who was helping her, we had all of those slides. They were beautifully done. They were very detailed. And then he went through them all, and he didn't need to do that. So I'll just say that. But we could have saved them time and energy. Okay.
That puts it on us. Just let's all realize that we have to come back and be ready with questions.
Absolutely.
Okay, so without further ado, Carlo and Karen. So we're having a little discussion about what's an efficient way to go through this list. And so I'm looking at, and we probably should post this list. So why don't I do that? Let me see if I can. Sorry, I have so many documents.
And Vanessa, I asked if this was possible before we got back on to dispense with the reading as we do in town meeting to see whether we could do this with all of the appointments that we're all in agree with and present them in one motion. And we think that's possible.
Yeah, I think that's fine. I mean, I don't see why we can't do it as a consent agenda style. And if there's any question for any particular one that we want to pull out, we just agree to pull that one out and move forward with all the others.
Are you guys seeing the Word document?
Yes. Yep.
Okay, great. So, so Carlo and Karen, kind of your show at this point.
I'll make a motion.
As a consent agenda, we'll pull out the ones that either you don't have agreement on, or if there are any questions that we have. I guess the third category for me was when you had a decision to make where someone wanted to move up to a full-time role from an associate, and it wasn't just a one-for-one. In other words, you had to select between certain ones. That might be helpful. Other than that, I'm fine with consent agenda.
To my recollection, and Karen can confirm, it was only not more than two. One being Recreation Committee, and that's the top of mind, that we had to pick one full, one associate, and maybe one other. I'm sorry, but most of them were just reappointments, and they sought out a full, or we asked them what would they prefer, because a full and an associate was open, and if depending on how many applicants there were, we put them into the roles of their preference. So what you see in front of you is, again, majority reappointments, a few switched from full to associate and vice versa, and maybe 10 to 15 new appointments, maybe a few more. And Karen and I worked through them. We had all the information presented by Jackie and Caitlin, and then on Thursday night, we filled in the spots. Jackie then, or Caitlin, I'm not sure, was nice enough to give us a spreadsheet with all the names inserted, which I have in front of me, and now is in a motion form here with all the names. So I read through everything. I am comfortable with everything. Seems accurate. I went board by board and committee by committee, and the only thing that we didn't get done in agreement was the Board of Health appointments that night.
Karen, are you comfortable with everything on this list as well?
Yes, I was having nightmares that we were going to get too many applicants and I was going to have to say no to people. And I was going to say, I can't tell you how happy I was in most of these cases. we did ask them, as Carlos said, do you want to be full or associate? And most times, if there was a decision to be made, they said they didn't mind. Either or is fine. And I feel like we were able to accommodate 99% of their desires. So yeah, I'm comfortable with them as presented, with the exception of the Board of Health.
Mark?
Vanessa.
Thank you. Did we, it sounds like there's a Board of Health discussion to come momentarily. Did we want to give Eleanor a heads up and ask her to rejoin? I don't know what that conversation is going to look like or if there's a need, but we did flag that, so.
Yep, so I'm looking through here just for a moment. So everything here. Okay, so great. So everything up to the Board of Health, you folks are comfortable with. The names are correct, the positions are correct.
Mhm.
So
Yes.
we could. Go ahead, Ann.
So I had meant to flag this for Bob or Caitlin earlier, and I may be mistaken in my memory, but I think we reduced the size of HRAC to help them achieve a quorum, and we probably are going to have to, as a separate agenda item in a future meeting, expand the membership again to 7, I believe, to make these appointments work. Unless we did it for just a finite period of time, I can't quite remember how we'd approved it previously.
Mark, if I may?
Please, Carl.
HRAC currently is a 5 full-member committee with 2 associates. And Karen and I approved 2 new members. So currently you have 5 full members, 1 associate.
Got it. Perfect. Thank you, Carlo. That's helpful.
Also, we did get help from Josh. We got help from several chairs of these boards and committees to keep us on track. They would dial in at the same time. That was helpful.
Yeah, we did. We got some guidance from Trails and Town Forest Committee and Josh and Eleanor and I think a few others. But yeah, it was helpful.
Yep, RHC.
Great. Okay, so would everyone be okay with this consent agenda other than the Board of Health? So kind of as it is now, where the blanks of Board of Health.
Yes.
Okay, so why don't let's take the motion, which I guess is a blanket motion up to James Mon as the last person on the list. Would that make sense to approach it that way?
I get something here. I can just add that if you want.
Please.
Motion to accept all VASC appointments as presented up to the appointment of Jamie Mon, including Jamie Mon, sorry.
Second?
Any discussion? So I'm looking. So some of these have different expiration dates, but they're accommodated in the motion, right? Because the motion is as written here.
Yes, some, Mark, some are reappointments. Some were reappointed recently and are filling out the rest of someone's term. So typically all the appointments are 2-year and 3-year appointments. And so if you see that, like, for example, Jamie Mon expires 2022, but he is a full member, he was recently appointed. So I'm assuming he's fulfilling someone else's term. And we'll have to reapply in 2022 as opposed to 2023. And that happened throughout.
Got it. Thank you. Okay, I'm comfortable as well then. Any other comments, questions? Okay, then let's take a vote. On the screen as I see you. Carlo?
Yes.
Karen?
Yes.
Vanessa?
Yes.
Anne?
Yes.
And Mark, yes. Okay, so we're 5-0 here. Okay, so now Board of Health. So we had this discussion before. I just want to make sure everyone would be comfortable and think it would be helpful. Do we want to invite Eleanor? Would she be a resource to this? Or Carlo, I detected a little reluctance, but I don't want to push.
No, it's not reluctance. It was she was there for our deliberations, which I really didn't expect. Emmy Dove joined in Andy Friedman joined in, and Nancy Doctor was on the phone, and Nancy Doctor didn't, say anything. She was there to listen, and she'd listened on several Board of Health interviews. So once we kind of ended our interview process, and it was time for deliberations, and Eleanor was invited for the interviews. When it came time to deliberations, I wasn't 100% knowledgeable, and that they should be part of the deliberations. It didn't seem right, but I didn't object. So they weighed in, and Karen and I both listened. And I guess if the board wants Eleanor, that's up to the board. I don't need it. I've had her input on several nights. So for me personally, I don't need it. But if the four of you or the three of you that weren't there want Eleanor on, that's up to you.
Mark, I think given that there is not a consensus coming from the VASC, normally this is pretty straightforward, but given the significance of the Board of Health right now, I would be very interested to hear from the chair. I don't know how the rest of the board feels.
And your thoughts?
I'm not quite sure what questions I might have, but I wouldn't mind the opportunity to run something by Eleanor if something occurs to me. So I would appreciate her presence.
I can actually understand that we did have a number of extremely well qualified candidates. Neither Carla or I have this scientific background or have ever served on a Board of Health, and we did find it to be helpful to have, I believe, Emmy Dove joined in as well. So I can see that it could be helpful for you folks. So invite her.
So I have done that. Let's see what happens. And she's responded yes. So Caitlin, she should be on her way.
We're going to have to give them a raise.
Yeah.
Yes.
Mark, can we get started in the meantime?
Yeah. So
While we wait for her to join?
what I was going to suggest is that since Carlo and Karen are the VASC members, I think I would ask that you folks share your thoughts on how the interviews went, the different people, and who each of you would be recommending. Carlo, do you want to go first? You're unmuted.
Oh, I'm unmuted. So sure. So for those particular appointments, Kevin was up for reappointment as a full member, and I chose that. And then we had a full member open. That was, I believe, Emmy Dove's position. I'm not 100% sure on that. And then we had an associate position open, and I appointed, or suggested, recommended, whatever you want to call it, Kerry Dunnell to the full, and Paula Curran to the associate. Karen?
Yeah, so we did have some consensus. We do have the three positions that we needed to fill. And, I also concur that both Kerry Dunnell and Paula Curran are extremely well qualified. They are available for the needed time slot, which is averaging 6 hours a week, plus occasional updates to the select board. Where we had the difference of opinion was to where they should go and the reappointment of the incumbent. So my proposal was to have the new members fill the full spots because of their scientific qualifications and because the board is so small, and ask the current serving full member to take on the role of the associate in these unprecedented times. I felt that we heard, and you can ask again, we understood that this person is definitely adding great service to the board, has some experience, and so the chair was comfortable with him continuing to serve an associate. So this is where our difference was.
Same candidates. The issue is full versus associate with
Yes.
Kevin and
Yes.
Paula, right?
Yep.
Same for the candidates. Yes, Mark.
Yes.
I have a question of the VASC.
Please.
Sorry if your presentations are done.
Yep, good.
Okay. So I went through this and I did some homework on this just because given everything that's happening right now, there is a tremendous amount of importance on what the Board of Health is doing and the demands on their time. Is there, and as I went through, there was a lot of really impressively qualified people who have stepped forward for this. And I know some were concerned a little bit about the time requirement, but I'm curious what the thinking was as far as not having three. I mean, there's one for renewal, there's 2 vacancies. Why we are not considering having one of the other experts in health or public health or academics specifically seated for all 3 seats.
So that question would be to me, I guess. Correct?
Well, I guess to both of you, because I think Karen had suggested that the incumbent be reappointed as an associate. Did I get that right?
Mm-hmm. Yes. No, we have the same 3 candidates. It was the question of what positions they would fill.
It's just one. Yeah. I mean, I'm just for both of you. Then my question is there a reason why we wouldn't appoint 3, various professionals in the fields of health or public health to the 3 positions? I realize that's slightly unorthodox. We generally always reappoint someone, but this is the Board of Health we're talking about, and we're in the middle of a pandemic, so I'm curious on your thoughts there.
Yeah, I can go first. I don't mind. And so the way it came about this was, and I agree, we're in the middle of a pandemic. So if Kevin were applying today as a new member, I am pretty confident we would interview him, but he probably wouldn't really be considered the fact that he doesn't have a medical background. But that is not the case as far as he's applying today. He's been on the board for 3 years. He has helped with the height of the pandemic, and all the guidance comes from the state. If not all, most of the guidance comes from the state. On Thursday night, according to the chair, Eleanor, and she can confirm this or not confirm this, that she spoke very highly of Kevin. They were meeting almost daily in the beginning, and he attended all, if not most of the meetings, read up on the material, was a very involved member. And the fact that he wants to continue during this pandemic and the time commitment really resonated with me, because he easily could have stepped down and just let his term expire. And to contrast that with the former chair, Emmy Dove, who had the most experience on the board with infectious disease, decided to step down or not renew or whatever her path was during the pandemic. So you kind of have 2 opposite things that happened. So that said a lot to me as well. And as we continue with the phases, the time commitment.
Carlo, I'm very sorry to interrupt. I've just gotten a message from a resident who was watching RCTV. It seems that there's a delay in the video. Their viewers are getting the water tower discussion as opposed to the Board of Health discussion.
Wow.
So I want to flag that. Sorry to interrupt, Carlo. I just want to make sure people are able to watch this for those that are watching live.
Can they hear us, Vanessa, or they can't do either?
Just take a look at what I got. Apparently, Mark mentioned the Board of Health, and then the video stopped. They're getting a recording of the water tower discussion. That's all I know.
Thank you, Mark.
Let me check if...
Okay.
Can I ask just for a second, Phil, or is there someone from RCTV who's monitoring right now? Are you able to fill us in on what's happening? I think that's a no.
It looks like it's still live on RCTV. It might be Facebook. I know we've had problems there in the past.
Okay.
I'm getting more information. Facebook, yes.
Okay, so RCTV.
I don't know what RCTV can do about that.
Yeah, I'm not sure there's much we can do about it. I think that so long as
Okay.
it's available, I think we continue. So sorry for the interruption.
That's fine. Didn't know if it was a bigger issue. Sorry, continue. Thank you.
Okay, well, that kind of broke the rhythm there. But yeah, I kind of made the points that I wanted to make. I really, having been, part of the VAS for the first time and enjoying it and meeting all the people, and I thought Karen and I did a great job. But when we came to this issue, and just for the board's reference, that we did not reappoint someone that wanted to be reappointed. I know that's a side note, but we're a town of volunteers, and anyone that wanted to be reappointed, we reappointed. And anyone that wanted to move from associate to a full, because of their life changes, we did that as well. And also, I became aware that at a recent Board of Health meeting that, and again, Eleanor can confirm that her time commitment to the board is going to change in the fall. So we need experienced board members that have been through this pandemic. And if we have an unfortunate spike, or with the guidance of the school, Kevin has been part of all this during the schools in March, April, and May, and now reopening of all the businesses. And I know there've been a lot of emails, and a lot of the board members have maybe gotten phone calls about we need all medical professionals. And all I can say is I would agree to that 100% if we were making all our own guidance and decisions. But we're getting most of, if not all, our guidance from the state. And we have a valued member who is willing to continue his service to the town in a very needed capacity. And unless Eleanor contradicts what I've said, there was nothing but praise for Kevin on Thursday night. Thank you.
Karen, unfortunately, has lost her connection. She's not here right now, which is kind of a drag.
I think, Mark, if I may, my questions were less of, okay, sorry, screen just changed. My question was less about, it's not about having a reason, a negative reason to remove someone. It's more about the potential positive contributions of some of these applicants. So Paula and Carrie jumped out at me. The other one that I was surprised wasn't considered was Teddy, what's the last name? Asher, who's an academic with a lot of experience on data and research. And when we talk about how rapidly information is changing, this is someone who professionally does this and is sort of up to date on the latest trends in the science field. So, and from what I understand, she's, sorry, I have my notes here. She's also a proponent of improving communication and making it more accessible to the public. So I very much appreciate everything Kevin has done to date. As I see, these long-term positions being available, I would love to have people that understand and know public health. We're hearing about the potential for a second wave. It seems odd to me to have someone on something as critical as the Board of Health with no public health background.
Thanks, Vanessa. Could I ask a question of Eleanor, since we have you here? Thank you for rejoining. It's wonderful that we have this incredible pool of talent that has applied. Can you talk to us a little bit about kind of what your thoughts are in terms of how we might be able to use that whole pool and kind of encouraging them to be involved with the activities? The one thing, Carlo, from your comment, the one concern, if you will, is that given that Eleanor can't give as many hours per week going forward, to have more of that very strong public health background, I think actually becomes a bit more important, as opposed to kind of more the administrative side, much more the public health side. But that's just my personal comment. Sorry, Eleanor, I kind of got in the way.
I have so many comments about, I can't figure out which one to start with. So I think I will start with, let's see, Mark, what was the last question that you asked me?
Your thoughts in terms of this great pool of talent.
Just in general, how to use, right. Okay, so one idea that might work, if this is something that we could do, is to be able to have a team of advisors. So everyone who applied and listed the Board of Health as their first preference was really highly qualified, and I see a lot of ways that their talents can complement one another. So for example, Teddy has that experience with health communication. There was a medical doctor who had a lot of senior administrative experience in healthcare. And so I think that if we could have an advisory board that people would be willing to serve on, I think that would really help encourage everyone who's come forward to make use of that public health expertise that they have. So I'm not exactly sure what that would look like, and I don't think at this point we have reached out to see if people would consider that, although it sounds like during some of the interviews, people were asked what role they would want to participate in, and a lot of people were willing to participate in whatever role we needed them to be. So here specifically, I'm talking about associate versus full, but my sense of hearing the interviews is that if people were on a sort of advisory committee where we sent them an email before the meeting and said, these are the issues that we're considering, can you read up about these issues and let us know what your thoughts are? I think that we would have at least 2 or 3 of them, and maybe 4 who would be willing to provide that service. So I think that's a way of making use of that pool of expertise that doesn't require as much meeting attendance as the Board of Health has been doing up to this point.
If I could offer, there's 2 ways to do that. The board could form an ad hoc committee for a more narrow purpose for a finite amount of time. Or, as has happened occasionally, not often in the past, the town manager can form a working group that's very similar. It's really up to the board.
We could also just do something informal and say the Board of Health in these unprecedented times would like to organize an advisory board to support our efforts. And then
I think you need to be really careful with that legally.
Well, it could be something similar to the ad hoc committee on human rights, where we don't have an advisory board, but we have a group of advisors who attend meetings and contribute.
Yeah, it just can't be formed by the Board of Health or by you to add on to the Board of Health. The Board of Health must be as described in the charter until changed.
So if I can suggest that we sort of table the advisory board discussion, because we still have 3 positions that we need to seat.
Agreed, but I guess one of the concerns I had and have is to make sure that we've got sufficient depth in science and public health. And we have an opportunity that we have to figure out. And to me, it actually is a really helpful part of that discussion. I can't separate it as, no, don't worry about that, just pick 3. I can't get there, I'm sorry. This, just by way of quick background, this one is a very difficult one for me. I think we need this strength in public health. It's very, very important. Mm-hmm. I look at the example of what happened at the Walmart, I believe in Quincy, but I think it was in other places as well. There are occasions where a person with a strong public health background has to make a statement and has to go much stronger than what the state guidelines happen to be. And in that case, there was an outbreak at a store. The store wasn't willing to do anything about it. And I believe the chair of the Board of Health, or I may be mistaken, it may have been the director of health, took a stand and stood up and said, "You're closed." And it was the right call, and it needed to happen, and that was in the interest of public health. And the state guidelines are a start, but they're insufficient. And I don't want to get into that situation here. I'm not comfortable seeing that situation happen where everyone kind of throws their hands up a little bit. That has to be what happens here. And this is some serious stuff that we want to deal with. Sorry, my comment. Other feedback. Sorry, Eleanor, you had a comment.
Is that okay? To that point, I think that while we absolutely have been following the guidance from Massachusetts Department of Public Health, we've also been consulting CDC, WHO, and the times when we need to consult those resources is when there's gray area. So there are policies that come out from DPH, and they might state that some outdoor facilities are open, but and there's a list with some examples, but then there's a question. And I think where the questions arise, it is really useful it would be helpful to us to have people who are knowledgeable weigh in and make those choices. But it's true that I'm not contradicting anything that has been said here, but I think it's those gray areas, kind of like the issues that you're talking about, Mark, although that wasn't a gray area. That was a place where the Board of Health took a really strong stand. That primarily, we are following guidance. And there are times when we need to make decisions on our own.
Mark?
Carl?
I agree with what you just said, but it's not a board of one, it's a board of 5.
With 3 votes.
Correct. Correct.
But in the case of that Quincy example specifically, a person took a stand. In fact, in that case, I believe it was the chair, took a very strong stand and made everyone else kind of get in line. And it made a big difference. It arrested a horrific situation where, unfortunately, the company wasn't being responsible or responsive and dealt with it.
I'm aware of a few stores, big box stores closing. I'm not aware of all the details and who made the statements, but yes, that was the right thing to do. And whether it was the health agent, a health director, or the board, I don't know the answer to that. And it doesn't sound like, it sounds like you're a little unsure, but I get what you're saying. But I'm still, unless Eleanor feels that Kevin wasn't a good member, which I didn't hear at all. I'd
like to interject here, Mark. I don't think it's appropriate to put Eleanor in a position to comment on the quality of the work that a co-board member provided. I'd like to remove Eleanor from that portion of the conversation. I don't think we should ask any of our volunteers to be required to state something like that. Given the recommendations that are a little bit split from the VASC and the amazingly qualified applicants that we have in front of us, I'd like to make a recommendation to the board for consideration, which is that Paula Curran and Carrie Dunnell be appointed as full members with Teddy Asher as an associate member. Given based strictly on qualifications, they're a nice, well-rounded group. Paula's a nurse. I feel like it's always helpful to have a clinician on a board. Carrie understands municipal public health, which is exactly what we need. She's well-connected. She knows what other towns are doing, so she could be really helpful from a best practices perspective. And I've already talked about, Teddy's role in academia. So that would be my recommendation for the board based on what I know of the candidates.
Can I just ask if, Anne, you're the other person who hasn't fully weighed in, that we've heard from kind of the VASC members. Vanessa, your point's clear as well. Anne, what are your thoughts here?
So I fully support the direction that Eleanor laid out of having a Board of Health with a deep bench in public health expertise, supported by a group of advisors in whatever form that may look like. I think it's been pretty clear from from my experience as the Board of Health liaison, and I think was made clear in Emmy Dove's comments last night, that there has been an inordinate work burden placed on the members of the Board of Health, and to expand the base, even if not in a technical change the charter, we can't do that immediately kind of way, but to kind of broaden the and I'm not going to say membership, but the workforce for the Board of Health by tapping into the wealth of candidates who came before us, as I think is absolutely the goal. I do think that Kevin Sexton has brought a tremendous commitment to the Board of Health and has done excellent work in following public health guidance, particularly rolling up his sleeves in light of the pandemic. And I think he does bring an ability to know how to get things done. This is what I've witnessed and heard from some of his colleagues. So I'd like to see us have a sort of group of public health avengers out there doing the good work of fighting COVID-19 and all other public health threats that come our way, like linking arms and fighting the good fight. I don't have a particular preference as to who is an associate versus full member, frankly. I don't think it really should matter very much in my vision of people working together to get things done. I don't think that the votes will be impacted tremendously, is my impression, given the I think unanimity in votes that have happened to date. So that's sort of my view. I would second the recommendation of the two members of the VASC in terms of what they're recommending in terms of who to appoint, and I can be kind of convinced, I think, as to who's associate or who is full, and I would hope that any and all of them would be willing to take on that responsibility and work together collaboratively with a group of advisors to get things done in the interest of the residents. And I have great confidence from everything I've heard of the candidates that they would do so.
Thanks, Ann. So let me weigh in a little bit also. So as even I think as Carla mentioned, I think in the ideal world, we were starting from scratch, and here we are at COVID-19, we would instantly pick all strong public health professionals and with some strength in communications and other things also. I think that's absolutely correct. Where I'm torn is that I think Kevin has done a really good job in kind of advocating getting things done. Not being able to do the homework is a drawback. He's not going to be the person to kind of get that information. And please, Kevin, if you're watching it live, I don't mean that in a bad way at all. And I'm torn because I want to make sure that we're able to do the best that we can here during this crisis and beyond. There are going to be other things that come up also. Kevin does have some knowledge in COVID-19 and has had some experience with it and has put in the hard work to get stuff done. And that can't be kind of just minimized. I wouldn't be comfortable with that either. I don't think that that's appropriate. Too, from what I've heard from everybody and looking at backgrounds and things, I think Carrie and Paula are very strong candidates, and I think those, at least those two should be coming in. And then the question from there becomes, how do we create this structure that's really going to help? We're only going to be allowed at this point to have 3 full-time members and 2 associates. Town meeting sent us an instructional motion to do the work, basically to bring to town meeting the opportunity to expand the board. I believe that's a November activity. It's not going to be sooner. So we're going to create a board now. We're going to figure out if there are ways to tap into the I love the Avengers comment, Ann, in terms of what we're going to be able to use here. But at the end of the day, we got to pick 3 people, and we got to decide what roles those 3 people will be playing. This one I keep going back and forth on, just to be honest. It's been very difficult just thinking it through. I can make an argument for either side. I can make an argument that we want all, a 3rd public health professional instantly. I can also make an argument that we don't. So I guess I'm a little bit swayable on this topic as well. That's kind of where I'm coming.
Mark, if I have an idea that might sort of get us where we want to go. You and Eleanor actually mentioned a really interesting perspective, which is needing members of the board who are going to be able to make decisions in sort of well-informed and well-researched decisions, perhaps on a moment's notice. Quincy's sort of an extreme example of that, but you just never know what might happen. And I think I have actually heard similar things about Kevin, helping getting things done from an administrative perspective. So if we pursue this path of an advisory committee of some kind, whether it be ad hoc or something else, that might be a really good place for him to play a supporting role while we have subject matter experts on the actual Board of Health itself. So we get the best of both worlds in that scenario.
I think it's important that we figure out how to do this broader group in a structure that's okay, but I think it's important that we figure out how to do that. Not tonight, I agree, but we need to figure that out.
Mark, can I weigh in a little bit?
Please, Karen, sorry.
I did want to thank Eleanor for coming up with this creative way, because that has been the struggle. Having these well-qualified candidates who couldn't commit, per se, to really give us all the time, but absolutely wanted to assist during this pandemic and had the right credentials. And even after we wrapped up our VAX interviews, we got another letter, which we were unable to get into the packet in time, from the clinical director of pediatric hematology and oncology at Mass General, who's also an assistant professor of pediatrics at Harvard Medical School, saying that we need to appoint committee members with health and science background, nurses, physicians, advanced practice providers, people with background in public health, epidemiology, or infectious disease, etc. And then at the end of this letter to the board, she also says, I would be willing to consider serving in some consultative role if you are lacking in candidates with clinical experience or expertise. So there's yet another member of our community who would be willing to step up.
Oh, I think that's awesome. Okay, folks, how do we get to closure? So I think that what I've heard loud and clear from everyone who's spoken so far, I believe, is that Carrie should be a full member. I don't think there's any misfire on that at all from anybody. Am I reading everybody correctly on that?
Correct.
Carrie will be a strong avenger.
That's our new term. Okay, next question. So I think, Paula, Kevin, and Teddy are the three candidates at this point. We need to pick 2 out of 3 and assign roles.
So Paula is also going to be a strong avenger, 47 years as a nurse practitioner, and now an instructor also at Mass General Hospital, former Reading public nurse. This is somebody who knows the job and somebody who is going to speak up for the residents and bring, this is where I'm out of my depth. This is the practical in the field experience, if you will. Eleanor, correct me. So, and who will be able to stand up and make strong decisions.
Which I think is crucial here.
Yeah.
So, and I think she's made everyone's list also. So the question here is going to be full or associate.
I think we need, I would like to say that it doesn't matter whether you're an associate or full, but I think on a board this small, it actually absolutely matters. The other thing, Eleanor and Emmy, the previous chair and the current chair, have struggled with is the fact that in a board this small, you can't talk to anyone else. You're on your own. You have to make, you can't make any kind of, have any discussion until you get in front of people in your quorum, in your meeting, sorry. So I think that is another argument for having the strongest medical science people on our limited voting board at this time. Hopefully we would be able to expand this board sooner rather than later, but we don't really know.
Are you able to speak with someone who is an associate member? Is a full member able to speak with an associate member outside of meetings?
Our understanding has been no, and we have not done that.
Okay.
Bob, any other feedback?
I don't think, Mark, I may have input on this. I don't think they're able to because if an associate member is elevated to a voting level member at a future meeting and they've had a discussion, they have an open meeting law violation.
Right.
The short answer is no, unfortunately.
Thanks.
And to be clear on that, if there's a situation where we don't have all three full members present, an associate member can in fact be elevated for that meeting. Is that correct?
That's also the way that we've been practicing this.
Thank you all for bringing that up. It hasn't come up to my attention. I was wondering if that was accurate. Okay, great. Good to know.
Mark, can I make a comment? There, as you all have stated, and Karen and I witnessed, there were a lot of great candidates. And for full disclosure, we started every interview with the time commitment because the website still states once a week. So that was a big part of our decision making. Our first interview was excellent. We had a biostatistician, a Harvard grad, on our last night. We had Teddy. We had a retired executive, a health executive. We had a lot of great candidates. And time commitment, a lot of it came back to time commitment. Karen can disagree or not disagree, but that was part of our decision making collectively, and then a big part of my decision making because Kevin has made the time and has continued to will to make the time. I'm not saying Paula, or where am I? I'm on my screen. The other two cannot make it, but until you do it, it might become overwhelming. I'm not saying that will happen, but they were all thrown in this position. Emmy, Eleanor, Kevin, and the associate. So this was thrust upon them, and they all did the best they could. And I think they all did a great job as a team. And now, we want to not disassemble the team, but move the team around. But, I've hired hundreds of people over the years, and experience matters. It matters to me. And I know depth of knowledge and industry and everything else matters, but experience sometimes trumps a lot of that, regardless of age or background. You hire a mechanic. Do you want to hire this ACE certified mechanic with all the degrees? Or do you want someone that really knows what they're doing and doesn't have to look at a book or a computer? So, we can debate that all night long, but that's kind of how I made my decision. Just to let you know, there were a lot of great candidates. I wish we could have picked all of them. But after we told them the time commitments, several backed off pretty quickly. And that was unfortunate because seeing those resumes was very exciting. And we got 2 applicants during our VASC meetings. We got 2 more, and Teddy was one of them. And I think his name was Brian. Brian was a biostatistician with a Harvard degree, but 3 children and job commitments, and he was unaware of the time commitment. And the time commitment could become even more so in the fall or late summer. So that's where I stand. Thank you.
With the 4 candidates that are kind of currently under consideration, did all of them indicate that they could make time? So between Carrie, Paula, Kevin, and Teddy, did all of them indicate that they can devote more than the few hours a week or a few hours a month that was on the website?
I believe Carrie and Paula definitely. I'm less sure on Teddy, but again, I think the applicants, they didn't want to say no to us either. So we were kind of reading body language, and so here's another point that I thought you all should know. This is going to be a high burnout position because of the time commitments. So it would be really important to keep these applicants, whoever we're unable to choose or appoint at this time, in some sort of communication with us, because we could definitely lose more members. We will need to stay on top of these appointments, I think, which is probably different than what we usually have to do. But unfortunately, we lost a chair. We could lose somebody else well before this pandemic is done.
I do feel like I should state here, just so everyone knows, because I think I've talked to some of you, that my professional role will change. Well, the role won't change, but starting in September, I just will have incredibly limited availability, and all I can commit to at that point is monthly meetings, which was what we used to do pre-COVID. So my role will change at that point. It probably doesn't make sense to have a chair that can only attend some of the meetings. But that said, I am planning for that now and have already shared with the board that information and sort of my plans moving forward to how us to, I can help us get ramped up and ready for that change to happen. And 2 months of experience during COVID times is sort of equivalent to a year of experience on the board during normal times. So I expect people to be able to be ramping up really quickly, whoever is the choice.
Hey, Mark. You mentioned we still have executive session on the agenda for tonight. I have an idea for how we can, if we are comfortable moving with, my recommendation is for Paula to be the other full member. And if we're not ready to make a decision on the associate role, perhaps we could table that as we work to find another way to make our advisory team for the Board of Health. So that way we have 3 solid members on the Board of Health to move forward, starting the end of the month. And that'll buy us a little bit of time to think about how we want to build out that support network for them.
A little bit of time, emphasis on little, right? Because we're in the middle of June.
Yes, very little, but won't take us till midnight.
Yeah, no, I don't think we want to head there. All right, so I think we just need to make some votes. It's kind of time to decide. So I think that we've kind of agreed, I think, on Carrie is full. I think it's now, we have Paula, Kevin, and Teddy, the other 3 candidates in contention. We need to just make some nominations for who should be the full, who should be the associate, and move from there. So I'm going to make a motion that Paula should be the full, the second full. Not a motion. I'm going to suggest it. How does that fit with people?
I can support that.
And I see you pondering.
Yeah, I've been on the fence about this, but I can support that, given particularly knowing that Eleanor is going to be stepping back, and I think we do need that public health depth.
Vanessa?
This is not an easy one for me, though.
No, this is
No, that's why we brought it to y'all. This was difficult.
Thank you.
Amazing, more qualified people.
Yeah, no, we've got a lot of talent, which is fantastic. So.
Yes, I would support Paula and Carrie as the 2 full.
Carlo.
Yeah, I'm sticking with what I stated. Kevin and Kerry is the full.
Okay, I can also see having Kevin as the associate and asking Kevin to participate in that way, to give the continuity to, because he's been a valued member of the COVID team. I think he brings a lot to what we're doing. And I think at the same time, it's a balance between kind of the public health and the experience and getting this done. And I think we need that. I think it's very important. And then I'm going to suggest that. How does that fit with others?
I support that. I hope Kevin will accept that appointment. I think he brings a lot to the table, and has a lot of experience that adds value.
Other comments?
I've already stated that I would support this motion. This was my preference at this time. And I strongly encourage us to keep in touch with these other candidates because we're going to need them.
Yeah, Mark, I'll support this. I mean, I think normally when we communicate to people that they haven't been appointed to a particular position because there's not enough vacancies, we sort of do a, stay in touch and thanks. I think with this group in particular, it would be nice if we could have a very different message sent out to them. Say, hey, look, we recognize your skill. We want to bring you on board. There's limitations. Would you consider being on an advisory board to this, or an advisory committee to this Board of Health? We definitely don't want to lose you. So it's a little bit different from a messaging perspective because I don't want them to just walk away and not come back.
Yeah, and
I would also recommend I would recommend against advisory board or advisory committee and just say advisors, because then you've got a whole nother group that's going to have to post its own, do its own posting, its own agendas, invite them to join the Board of Health meetings when they can, or if you have, if the Board of Health decides, this person we remember from the interviews had this set of expertise and we're hoping to create some kind of educational piece on this topic within their expertise, let's reach out to them.
Well, we can call them consultants. I mean, as long as they're on that email list so that they know when that meeting's coming, I don't care. We can call them vendors for, that's fine. Let's just get them to the meeting.
Maybe, Eleanor, we can craft, if you'd like to do it, or if you'd like to do it jointly, or if you'd like us to do it, I think any of those three options. But I think it's very important that we reach out beyond just the three that we're going to be able to appoint.
I totally agree. I'd be happy to draft something, and I would want, though, some review to make sure that we have the language correct that doesn't add additional hurdles, but that just allows us to communicate and make use of that expertise.
Great, thanks. Okay, so I think we need a motion for Carrie as full, Paula as full, Kevin as associate, please.
Okay. All right. Motion to...
Note that one is for 2021 and one is for 2020.
So we have 2020,
So one is
2021, and 2022.
21 and 23, yeah.
Oh, so that's really interesting. So one of the fulls is to 2023, one of the fulls is to 2021, and the associate is to 2022. I don't think we could complicate it further, could we?
Can I suggest, since Carrie was our number one, can I suggest, she was unanimous across the board, can I suggest that she be the one that has the term expiring in 2023, that Paula be the one expiring with the term 2021? And that Kevin be the associate expiring in 2023.
Associate is 2022.
Yeah, 2022.
Oh, they're 2 years. Okay, I take that back. 22 then.
No, sorry. Let me get the screen up again so we can see it. Shoot, which one? I think it's this one. So the full is 2023, the first one. The second full is 2021, and the associate is 2022.
I'm ready, Mark, if you're ready.
Great, let's vote.
Yes. Please, Carlo.
Okay. First one, 23. Okay. Motion to appoint Kerry Dunnell to a full member of the Board of Health with a term ending June 30th, 2023.
Second.
Second.
Thanks, Vanessa. Discussion? Non appearing. Votes. Carlo?
Yes.
Ann?
Yes.
Vanessa?
Yes.
Karen?
Yes.
Mark? Yes.
Okay, second motion. Motion to appoint Paula Curran to a full member of the Board of Health with a term ending June 30th, 2021.
Is there a second?
Second.
Vanessa, your light went on. Discussion. Not appearing. Carlo?
No.
Vanessa?
Yes.
Anne?
Yes.
Karen?
Yes.
Mark? Yes. Third motion, please.
Okay, last one. Motion to appoint Kevin Sexton to an associate member on the Board of Health with a term ending June 30th, 2022.
Is there a second?
Second.
Karen, you lit up on that one. Discussion? None appearing. Carlo?
No.
Vanessa?
Yes.
Anne?
Yes.
Karen?
Yes.
Mark? Yes. Thank you, Eleanor. Thank you, members. We're on to the next. So it is 10:26. So I see Jane is still with us. And we do want to have a little bit of discussion in terms of the executive session, I think, as well. So I'm going to suggest, should we have a quick discussion related to the retreat and what it is that we want to accomplish? Let me give a little preamble. Maybe that's a good starting point too. So given Vanessa's comments from before and all the homework that Jane kind of put into this to share what was going on for the 5 members, we had a structure where we could not have any other agenda items on our list, talk more about how we work together as a group and what each of us feel are our priorities, and then to try to come together and see where those priorities overlapped, and also to see if there were disagreements, areas that didn't work. You've got the results of all of that. I think that there were a couple things to me that stood out particularly. One of them, and the strongest one, I think, was a desire to find a way to reach closure with residents and with staff, kind of this communications link. So it's an external as well as an internal. It's an area that I think we all agreed we wanted to work on. Part of it was driven by a way to get answers to residents to make sure that we've closed issues. And I think part of it was so that we could kind of be accountable and kind of check things off, as we finish them. I think there was very broad agreement on that one. I'm sure everyone's kind of read through the packet. You can see kind of what else is there. I think we had some short-term goals and some long-term goals. And the shorter ones were working more effectively and efficiently as a board, and the longer ones were more kind of general priorities that we had. They ranged from talking about sustainability in town activities to working more closely with RMLD, to a variety of other ways that we might want to do that. What I've envisioned for this next retreat is kind of 2 main things. One is to let the 2 new members of the board absorb all this material, see kind of how we approached it in terms of the kinds of things that we thought were most important. Let you folks weigh in yourselves. So after having read it, seen what we talked about, kind of weigh in yourselves, see what's there, see where you have agreement, disagreement, make a broader list of priorities. We started out, so with a brainstorming session, and I think that's Jane's early documents are these very voluminous pieces where there could be 10 or 20 or 30 or more items that each person brought up. To kind of see what those look like, then tie them back. I was thinking that we then ask Jane to kind of take a look at that, merge it back together. So it was 5 people's opinions, 3 of them are still here, and there are 2 new people's opinions. Merge those together, kind of see where we are, and use that as kind of a kickoff for what is it that we want to accomplish in the next X months. It's changed a little bit in my view because of COVID. It's changed because some of the things that we talked about, some of the capital sorts of things, might not be on the front burner right now. They may have to go to the back burner. Some of the more, what are the needs of the town, what are the needs of communities, what are the needs of activities, I think need to come to the front burner. I think that this discussion fires into the discussion of the goals we want to work on with Bob for this next fiscal year. So July 1st going forward. I think that our priorities, what we see as most important, we need to make sure that those are included as part of Bob's goals. And again, I think there are short-term pieces as well as long-term. So to me, the retreat, the discussion of Bob's goals really come together, and a little bit kind of, sorry, I don't mean to be pointing with my pen, but Vanessa's discussion also of some of the items that we as a board need to think about. What is it that we feel we need to accomplish as a board? I think is very important. And I think that's our job. I think that's what we need to do. So that's what I was thinking of as a process. Let me stop and ask for other people's opinions on that. Maybe start with the folks who are continuing. So Vanessa and Ann, if you could talk next, and then open it back to Carlo and Karen.
Yeah, I mean, I'll jump in. Thanks, Mark, for the intro and the background for the new people. When we first broached this idea of a retreat, my comment was we talk too much. We talk a lot, and we spend a lot of time talking in circles about all of these discussions. And it's funny, right? Because normally you can't see everybody. Right now, everyone's on Zoom, and I'm getting a lot of nodding heads. Like, we talk too much. And I think we spend a lot of time going into the minutia of a lot of, administrative or operational issues that aren't necessarily a good use of our time. And if we trust the staff to do their jobs well, and they put a proposal before us, we say yes, we smile, it's a consent agenda, we move on to some of these bigger issues that are really why we're here, to set policy, to move things forward, to look ahead. So, as far as the retreat goes, I think it's great. Would love to get input from Carlo and Karen because they bring new perspective. But I want to spend less time on the minutia, and I'd love to spend more time on bigger topics that are more relevant to residents. So yes to everything. Let's just do it faster.
And I take your point that let's talk about more high-level issues and spend a lot less time on items that are more or less being presented to us for approval. Let's do our homework. Let's read them. I can tell you that, and Jane, Bob, you can back me up on this. One of the discussions we had at the last retreat was counting on each other to do all of our homework before each meeting. If we don't have that as a commitment between us, then, Vanessa, that idea that you're talking about fails. Everybody's got to do the homework. We've got to come in prepared. I don't expect, but who knows, that we're going to be meeting every single week. Right? Hopefully it's twice a month, or roughly, or 3 times a month, whatever it's going to be. It backs off a little bit, but we all have to keep each other honest. That has to be part of the deal if we go that way. And I think that's an important topic we discussed, and something for new folks to be thinking about as well. Ann.
Mark,
Go ahead, Vanessa. Sorry.
I also think these aren't things we need to beat into the ground, right? We all know we have to do the homework. If we take a different approach to the meetings, we're all hopefully responsible adults. If you're not prepared for the meeting and the discussion doesn't go into depth because of it, then that's sort of too bad. You should have done the homework. I realize I sound a little ruthless here, but we're never going to make progress if we slow everything down.
Thank you. Ann?
So I don't know if that's something we need to talk about. That's something that we just do.
Well, so I think part of the retreat to me was to establish common goals, establish agreement on them, and not just nod our heads on Zoom, but to be at a retreat and nod our heads on Zoom. I think that we all have to be committed to that. And I think it is, we saw that it didn't always work in the past. And I think that, this is a new group. I think we all have to agree to it. And we all have busy lives. That's not the issue. It's just understanding that needs to happen in order for that process to work. Ann.
To use one of the phrases that Jane taught us at the retreat, I echo what Vanessa said. And I would also point out that some of the specific recommendations that Vanessa made earlier as part of her point of personal privilege, I think would probably fall into the category of my main priority that I had highlighted in our retreat, which was fostering an inclusive community. Thank you.
Thank you. So that's the 3 of us. Carlo and Karen, would you guys like to chime in, please?
We can always count on Vanessa to get right to the point. I love that. I loved the points that she brought up earlier as well as part of her personal statement. ending ending divisiveness. The flip side of that would be encouraging inclusiveness, very strong priority, as well as climate initiatives, and nicely summarized by Vanessa. Thank you. So I can agree with that, and I can do my homework, and we can be ready, and staff does not have to read slides that they've already prepared for us, and I think that can make us go more quickly. So I look forward to anything else that we can bring to the retreat and get out of it and bring back to the board and do a better job for our residents and businesses.
Thanks, Karen. Carlo?
Yeah, thank you. I read through all the minutes and the stuff you guys did, and I felt like I was back in college. And I was excited about a project. I'm being honest.
That's awesome.
I miss those days. I was a business management entrepreneurial major and did a lot of case studies and did a consulting project in my last couple of years of school, and really got into my major. And when I read all that Jane prepared, and then you guys, with all the responses and it really felt like I was back in college. So I look forward to it. I want to see the town resources, meaning the land, the buildings, more utilized. I'm all for green energy. I'm all for doing better for the environment. We do it in our house. Hopefully encourage that townwide, and just to make us a welcoming community, because as we saw from the rally, we're a pretty white town. I don't think that's a surprise to anyone. And it's not that we're not welcoming. It's just, I don't want to get into that debate or discussion, but obviously we can do better. We can do better for town staff employees. We can do better for our students. We can do better for everything. So one of the reasons I ran was to move the town forward and get stuff done. And, in the big picture stuff, even though that takes a number of years. What are we going to do with the Zani property? What about Walker's Brook 2? Those are far off things, and COVID has maybe pushed them off even farther. But that's always in the back of my mind, highest and best use for the Zani property. How to connect the two, downtown and the second downtown, Walker's Brook 2. How do we make the town more walkable and safe, and all these things. So I look forward to it. I agree we can make better use of our time, but things come up, and we all have different opinions and different backgrounds. So talking in circles is not fun, but then don't be a town meeting member if you don't like talking in circles, because that's what we do at town meeting. So so I agree with Vanessa, but it's easier said than done. So we're 5 individuals trying to work as a team, but I'm all for it. Trust me. I do not love 11:30 every meeting, but I knew what I was signing up for, and I'm willing to do the work. And I try to be as prepared as I can and read through everything. I read through the water tower presentation. I didn't really have any questions. I really didn't. But it was in front of us, and so and things like that. So I look forward to it. Thank you.
Thanks, Carlo. Jane, can I give you the floor for a minute?
Sure. I will not take up much of your time. I was up with all you folks last night as well, and I didn't hear a lot of circle talking, Carlo, last night. People were pretty great, and you did
not last night. Not last night. Correct.
Yeah. Exactly. I've heard about previous town meetings. So to your point, I think we should at some point, and maybe we can move this part of the conversation offline. And if the board's comfortable, I can work with Mark on scheduling a date in July for doing a virtual, or we could do a socially distanced one, depending on how people are feeling. I'm comfortable, small group, less than 10, we can maybe still do something in person. So something to think about. What everybody's comfort level is fine by me. I heard a lot of congruency with what you were saying, Karen, and what you were saying, Carlo. And I definitely heard from everybody, let's work on streamlining the meeting. So we can, I can come up with an agenda where we take the goals that are listed in the draft. I sent you a draft. I found problems with it. When I was reading it, there are some typos. That's why draft is still on there. So as a former editor, it makes me nuts when I find my own typos. But when you go through that, I can do a separate exercise with Karen and with Carlo to have them isolate their goals and then kind of map them to the groups that we've already done. We can do that all offline. You've given me a highlight already of what you've got, and then pick your top priorities based on everything that you've seen. And so we can then take that information and go forward, because what I thought was one of the key takeaways is not just what you highlighted in terms of goals, and it's 5 long-term, it's really 4 long-term, 4 short-term, which is great. That's 8 things. That's 8 things to work on. That is a doable number. You had more than 70. And you'll have 90 by the time this is all done. So originally, and so being able to kind of distill it down to 8 things that are actionable, that's a doable thing. The other thing I thought was interesting is that of all of those things, there were only a handful that there was really any disagreement on. Like, we want to do this, and somebody else said no. No, I don't want to do that, or I disagree with how you want to do that, or whatever that. And so that's very low. I mean, that's only 3 things people really disagree on. That's pretty, it says a lot. The board really is mindful about leading the town and working to kind of move things in the right direction. So I think those are really important takeaways. What I suggest is that we kind of isolate those goals. We come back, we talk about how to streamline meetings, which is a top goal for you folks, and then talk about how you want to tackle the other things that you've got going on. And then we'll work a little bit on working together and then what's the messaging you want to go out forward. So we can take a morning, we can take an evening after work, whatever you guys want to do, and just take 2 or 3 hours, but we'll do it, in a room somewhere, or we can do it in a virtual setting, whatever people are comfortable with. But if you folks are fine, I can work offline and not take up any more of your time tonight, and it'll be a little bit more streamlined. So, and it's easy. Okay.
I think that sounds great. And Jane, I know for the benefit of Carlo and Karen, you've done this in other places already. I know Wakefield, I don't know if there are others, but I know in Wakefield you kind of managed an even bigger process than what we're talking about.
Yeah, it was a lot. It was more like 5 hours. It was a little bit different, and we did some other stuff. We went over their charter review. We talked about how the things in the charter map to the roles of the council that they have. We did a few other things, and we can do something like that here. I used to use this sort of a process when I worked in consulting 100 years ago, but I did this stuff with like bigger companies, not municipal government. But it's a process that works well, I think, for most people. And we don't have to belabor it for hours and hours either. We can move right along. So you'll come out with some. Right now, you've got 8 things you can already work on. We'll incorporate the new members' information, and then you'll have some synergy and some energy to move forward and work with the town manager on the goals that you're looking for. Okay? Sound good? So if everybody's cool, I'll talk to Mark about setting up a date down the road, and we'll look for something in July. I'm pretty open. Okay.
Awesome.
Sounds good. Thank you.
All right. Thank you.
Mark, if I might.
Please.
The board's been through an extraordinary few months. I think you've been a little hard on yourself. You have to look back and realize you've been mainly in a reactive mode for 3 months, and that was not wrong. That was essential. I agree with a lot of what's been said, and I think you need to give yourself a better opportunity to succeed. If you want to tackle the bigger long-term issues, you need to space that out over more time. You can't be meeting every week and expecting to do all this homework. Now, this comes to a style question, and I don't ask you to be the same. You be whatever you want. But I will observe, and I don't mean in the last 3 months because it's not fair, but for most of the time I've been here, select board members visited staff more often. Now, some of that was they had availability during the day, and some others may not. But a lot of the discussions that happen at your meetings used to happen in town hall. So the understanding, would happen, and then a better prepared board member, if you will, would come into the meeting. We're here to offer whatever style works for you. It doesn't matter to me, but if that's helpful for some members and not others, that's fine. However you best learn, however you best work, we'll try to work with you. But I think that to chastise yourselves for not being as productive is certainly not accurate for this year.
I would concur with that as well. As a selectman in another community, we're still meeting every other week, and we've delegated a lot of our stuff off to our staff. So you guys are meeting a lot. You're working really, really hard, and you know, it's appropriate. Everything has changed since we had this retreat. Everything. This was a pre-COVID world for all intents and purposes, and the entire racial justice issue has come up as well. And Reading is really just making leaps and bounds and doing a lot. Just the community has got so much energy and is doing so much. So Mr. LeLacheure's comments are, I would echo them in this regard.
Thank you, Jane. Can I make a suggestion here? Let's see if okay with all to move our next discussions, the specifics of town manager goals and review, although I want to make a quick comment on that, to our next meeting on the 30th. And rather than, let's give ourselves a quick break. Again, I reiterate, if there is something that comes up related to a license or some other activity, please feel free to reach out. I see everyone nodding their head. We would be happy to get together on 48 hours notice and we'll figure it out, particularly if it's not a 4-hour meeting. So let me just make a quick comment, and then why don't we'll make a motion toward executive session quickly. The review process and the goals. So there are, in your packet, there's a lot of stuff, and some of it related to deadlines for doing certain things. And what I'd like to make sure that we do, I guess, are a couple things. One is that we owe Bob a review that I believe he has to receive by August 15th, if I have it correctly. And then we have to discuss it and take whatever action by September 30th. I think those are the guiding dates. So August 15th latest. I'd love to see if we can tackle it in July if it's possible, but again, we'll talk on June 30th. That's for the review. As it relates to the goals, I think, you know, Bob has a first draft that he sent out, and maybe Bob, you can share that with everybody. I was not going to say not right now, but separately. Just send it to everyone, just to do some thinking about it. Take a look at it. And on the 30th, let's talk more about kind of what's there that we agree with, what's missing, and where we want to take it. You know, this notion again of short-term and long-term. It's a 1-year plan per se, but obviously we're a town and 1 year doesn't cover it. So we've got to be thinking about what's measurable, if you will, in a year, but relates to a longer-term set of goals also. So I'd encourage you to do that. And the one thing that I've kept in my mind so far is that in this post-COVID world, a lot of the things we've talked about, you know, allocating capital and getting community priorities for capital and buildings and what are we going to do with all this money, I think that's changed. I think that's on pause. What I don't think is on pause is figuring out the needs of the community, figuring out what that means more from a programmatic point of view, perhaps, but really kind of we should get this understanding anyway, but I think we need to think about it in terms of what can we implement in the year 2020 and 2021 that's going to have the most impact on the most positive impact on most residents in this town. It's got nothing to do with building things. It's got a lot to do with how we work with them. And I think, to me, that's the one thing I'm putting on an additional lens as I'm starting to think about these things in terms of goals. So I did that. Sorry, Vanessa.
I was going to suggest we go into executive session.
Well, that's what I was just about to do. But we need a motion. Do you have one, Carl, already? I actually created one if you don't have one.
No, I don't have one, but when do we approve all these minutes?
30th.
Okay.
They're there. And again, you know, I would ask if anyone has any comments on them, why don't you send them off to Caitlin? I am fine with them as they are. If there are any comments, let's move them that way. Okay, let me get to this one. Sorry, my screen has gone slower too. Carlo, I believe this is the correct motion.
Okay, I'm ready.
Please.
Move that the select board move to executive session to consider the purchase, exchange, lease, or value of real property that the chair has declared that an open meeting may have a detrimental effect on the negotiating position of the board and not return to regular session this evening.
Is there a second?
Second.
Okay, sorry, I just got to get to my screen again. I've lost people. 1 second. Okay, so roll call vote. Carlo.
Yes.
Ann.
Yes.
Vanessa.
Yes.
Karen.
Yes.
Mark. Yes. So we are adjourned from regular session, moving to executive session, and not planning to return. So folks, stay on. Board members, stay on, please. And the RCTV coverage should stop here.